प्लेट का रखी
सीधा वंडरफुल लाइसेंस काम देने की चालू થઈ જાય વાહ
हां सेलेक्ट किनावर से बाइक किया
Good morning, everybody.
Good morning, sir.
Good morning.
Sir, I welcome you in this morning session. Thank you for accepting our request for the talk. I request today's morning session chairman, Dr. M.D. Odedra, to address your biodata.
Good morning to everybody. Good morning, sir. Today we have three eminent speakers, and the first and foremost one is none other than our Honorable Vice Chancellor, Sri N.H. Kelawala, sir, who has graduated from the Veterinary College, Anand, in the year 1986. He has started his career as a veterinary officer in the Department of Surgery, Veterinary College, Anand. For his doctoral research from G.B. Pant University, he was awarded as Jawaharlal Nehru Award for Outstanding Agricultural Research by ICR in the year 1996-97. He was deputed for Bilateral Collaborative International Exchange Program of Indian National Science Academy, that is INSA, New Delhi, to People's Republic of China and Brazil in the year 1999 and 2005-06. He was elected member of Gujarat Veterinary Council for the tenure of 2007 to 2012. He joined as Dean at Veterinary College, Navsari since the establishment of the college in the year 2008-9. During his tenure as a Dean, developed the Veterinary College, Navsari, and was instrumental in getting it recognized by VCI, which is the first after enactment of VCI Act 2008. During his academic career, he guided 20 MBSc students and PhD students and published more than 50 research articles in national and international journals of repute. He has joined as Vice Chancellor, Kamdenu University, Gandhinagar on 26 October 2018. He has also participated in the second regional workshop for veterinary education establishment and veterinary statutory bodies during 19-20 November 2018 at University of Tokyo, Japan, as an OIE-sponsored Indian delegate nominated by the Ministry of Agriculture, Farmer Welfare and Cooperation, Government of India, New Delhi. He was recipient of fellow from Indian Society for Veterinary Surgery, ISVS, National Academy of Veterinary Science, and Indian Association of Advancement of Veterinary Research, that is the IAVR. He was awarded gold medal for the best research paper presented and published in ISVS, besides many awards from reputed societies. I welcome you, sir, and now I request our Honorable Vice Chancellor, sir, Dr. N. Kelawala, sir, to present his lecture.
Good morning to one and all.
Good morning. Good morning. Screen share.
Skin share, yes. Where is the? I already sent you file, Dr. Shivaji. I already sent you through email.
The Gmail.
Yeah.
We will operate from here only.
Okay, you can operate from there. So good morning to one and all. On this occasion of National Agriculture Higher Education Project IDP, 5 parties are together: Panch Ratna, NHP, IDP, ICR, Junagadh Agriculture University, World Bank, and Department of Veterinary Surgery and Radiology, College of Veterinary Science and Husbandry, Junagadh. On the last day of this online vocational training on advanced diagnostic techniques in livestock and pets, first of all, I am thankful to the Junagadh Agriculture University for giving me a chance to deliver lecture on my topic, that is can you share my PowerPoint, please?
Sir, 1 minute.
Yeah. Role of alternative and complementary medicine in veterinary surgery with special reference to acupuncture. As given by chairman of the session, Dr. Oredra, he has given my introduction, and I have done my PhD on acupuncture in GB Pant University of Agriculture and Technology in the year 92-95, and I have been awarded Jawaharlal Nehru Award for the same. Are you sharing there?
So please open the PPT. It has been shared. Yes, and give it presentation mode.
Okay. So, do you getting my screen now?
Yes,
Yes,
yes.
yes, sir. Yes, we are getting it, sir.
So, role of alternative and complementary medicine in veterinary surgery with special reference to acupuncture. When you give this topic to me, I was surprised, as in this scientific era, how to justify this topic. Of course, alternative and complementary medicine, if you see the definition, and is given by complementary and alternative medicine, veterinary medicine, defined in 2001 by American Veterinary Medical Association, is a heterogeneous group of preventive, diagnostic, and therapeutic philosophies and practices. There are various diversity of approaches that constitute CAVM, range from well-studied to bizarre to baseless. I can say that this technique is in India. I can very well say most of the people they do barefooted doctors, and because of that, this technique is not been very well practiced in India. Now it is responsibility for protecting and benefiting veterinary patients remain with the scientifically people like we all. There are various types of complementary and alternative medicine. One is acupuncture, homeopathy, Ayurveda, laser, chiropractic, that is massage, naturopathy, nutraceuticals, and many more. Even aromatherapy, it comes under complementary and alternative medicine. Yoga comes under complementary and alternative medicine. This acupuncture, there are varieties, means you can say varieties of acupuncture. Acupressure is one type of, it comes under acupuncture. Moxibustion, one plant is burnt at the point. Electroacupuncture, if you give electric stimulation. If you give some fluid at the acupuncture point, it is aquapuncture. Auriculotherapy, Sujok therapy. So my topic will be restricted to a special reference to acupuncture. Coming to the introduction, it's an ancient art of healing recognized by WHO also. And if you can recall Mahabharata epic and Bhishma Pitama on Bansaya, he was not feeling pain. Acupuncture in veterinary medicine presents growth in its use, especially in China, Japan, and nowadays in Latin America, Brazil, Argentina, in spite of its Indian original technique. I can say, if you go to the history, Yuan Shen comes from China through Northeast. He has taken this technique from India and he has developed this technique in China. We people think that it is a Chinese medicine. If you go to the ancient time, it is an Indian medicine. We people in India were treating these cases through acupuncture. Even people in India wearing earrings, nose rings, finger rings, making tattoos anywhere on the body. Nowadays, even near eyes. You can see the figure here. Means you can see everywhere there will be acupuncture, and that gives some feeling of treatment. Auricular therapy and Sujok acupuncture is also comes under acupuncture. Now this is regarding Sujok with hand. You can treat any ailment in the body. With foot, you can treat any ailment in the body. Now coming to the auricular therapy, you can see our ear, and ear shape of the ear is just like fetus in the womb of the mother. When we studied during our era, our Guruji used to do like this. This directly affect our brain. As brain is here, head is here, this spinal cord, this hind limb, this forelimb. So this is auricular therapy, and this therapy can be very well, even we can put, ladies put earrings. That means that makes beautiful face. So this comes under acupuncture. Even this is a horse ear. This is also showing some of the space of fetus in the womb of the mother. This is a reflex phenomena for diagnosis and treatment of any ailment in the body. These points are hypersensitive of certain points to pressure and electric current, the dermatome. So if you go for needling at acupoint, what will happen? And we will go for needling at non-acupoint, what will happen? So needling a false point will increase pain threshold, but needling the acupuncture point is more effective in elevating pain threshold and tolerance. These are reference given by all these writers. What will happen if you go for true versus some false acupoints? If you go for some needling without any acupoint, it will also reduce the pain up to 30 to 55%. Chronic pain is reduced. True acupuncture, it will reduce pain from 55 to 85%. Stimulation close to the site where the ailment is there. Suppose in the hand, if you acupoint near the site of the ailment, that gives better result as compared to distant points. These points are physically, physiologically, and histologically different when compared to the surrounding areas. It's just I am giving glimpses how this differs from the rest of the body parts. Acupoints, histologically, you will see there is greater concentration of mastocytes, lymphatic vessels, capillaries, venules, arterioles, and nerve endings. It has got lower electrical resistance power as compared to surrounding skin area. As you can see, direct current resistance in normal dry skin is about 2 lakhs to 2 million ohms, where acupoint has got 50,000 ohms. That is lower electrical resistance. You must be surprised when we are scientists. We must know what is the real mechanism, how we can describe acupoints. These are very good scintigraphy, nuclear magnetic resonance imaging, and Killian photography depicts the body's aura. We can have aura in our body, human energy field that is not audibly visible. And this is a Killian photography, high voltage 15,000 to 1 lakh watts, low ampere, high frequency electric current. This will use the picture with Killian photography. Scintigraphy also, you can see that nuclear magnetic resonance, if you give, it will show the points and it is going towards the meridians. Here I can see this is non-acupoint scintigraphy. Here it has been shown that it is only restricted to this side. But here, if acupoint is there, it is going towards the meridian. It is an imaginary line besides blood vessels and lymphatics. I can say that this is just for information of this scientific gathering. That this is, by this means, I want to ignite the scientific acupuncture. It will take time. Even some of the times I fail to get the results. But if you go on practicing, and if it is scientifically evident that if you practice this acupuncture, it will 100% give results. Of course, patients you to select like that, they can be under your control, especially in veterinary practice. I am telling, if patients are under your control, you can very well treat this any ailment through acupuncture. So this is a nuclear magnetic resonance imaging. Here this is non-acupoint, and here acupoint you can inject here. It is going towards the. It is going towards the meridian. Similarly, here this is in the man. Here you can see, here this is by the COAS. It is Killian photography. Here injection is there and it is going towards the meridian. This is imaginary line and it is going in the line of meridian I can just give how it works. There are many therapies. We can think that being we can say that this is Chinese. I don't want to talk on this Chinese method. Being Indian origin, as we people, we scientists, we Indians hate Chinese. So in being Indian origin, I want to give more emphasis towards our Indian philosophy. Of course, this is in the literature, yin and yang theory. Yin means that is the medial side of the body. Yang is facing towards the sun, and yin is against the sun. Theory of 5 elements. We must know Pancharatna, Panchgavya. Then means everything. There is five elements theory is there. Anything is there. There is in these five elements. Motor get theory. These scientific very well approved. If you give tolerable pain stimuli to any human being, then nociceptive pain stimuli will not reach the spinal cord, will not evident pain. This motor gate, that gate is closed when you give tolerable stimuli to human beings. Now, neurohumoral theory, this is the most advanced theory, and because of this theory, people are believing that acupuncture works. There will be neural secretion is there, that is endorphin, enkephalin, and because of that, we are getting acupuncture effect, pain relief in human beings or veterinary people. Eastern and Western concept of acupuncture mechanism. We Eastern means Chinese and Indian, and Western, that is Americans. This is flow of blood and chi, balance of yin and yang, excess and deficiency, and 5 essential components sustain homeostatic balance. Western people, I just now told neurohumoral theory that enkephalin, endorphin has been opioids and be released through acupuncture, and it will give pain relief. And in 1974, International Veterinary Acupuncture Society (IVES) was established in USA with less than 20 members. It has reached to almost 2,000 members today. And if you want to get any information regarding acupuncture, you can visit this site. You will get almost complete information regarding acupuncture, and it is well accepted. So this is regarding 5 element theory. Nothing is destroyed, nothing is created. When wood is getting fire, it will give rise to earth, metal, and water. So similarly in the body, we are having wood, we are having fire, we are having earth, water, and metal. So if you can say heart is fire, spleen and liver is earth, lung and large intestine is water, we say metal, then kidney and urine bladder water, and liver is wood. So from this side is creative side. From heart to this side, lung, bladder, kidney, liver, this is the creative side. But if we bypass, this lung bypass and goes to direct wood, it is a destructive side. So by this means nothing is created, nothing is absolute. So this is a complete 5 element theory. And if you give some scientific name, that all these acupuncturists are having 12 meridians. 12 meridians and 2 unpaired. One is dorsal ventral line and one is ventral line. So these are the meridians given internal organ: lung, spleen, heart, kidney, pericardium, liver, large intestine, stomach, small intestine, bladder, and then gallbladder, kidney. These are the 12 pair meridians, and 2 unpaired is 1 dorsal midline and 1 ventral midline. So Western nomenclature, we people believe that we are accepting Western nomenclature. Meridian numbering system, I already told there are 12 meridians and 2 unpaired meridians. Related with internal organs having alphabetical abbreviation prefix meridian with suffix represent sequential position of that particular number on that meridian. So I'll say lung, there are 11 points. Lung 1 means first point on the lung meridian. Lung 4 means 4th point on lung meridian. Lung 11 is the last point on the lung meridian. Similarly, large intestine, 20 points are there. Small stomach, 45 points are there. Spleen, 21 points are there. So there are total 361 regular points, and in 14 meridians. And there are extra points. There are 44 points on head and neck, 12, trunk 11, limbs 21, and there are RC point, tender point near the site of ailment. If you are say traditional nomenclature system as being adopted by the Chinese, will not understand. The original Chinese name of acupoints have anatomical base, that is Vijan. If it is at the tail of the tip, we can call Vijan. Physiologic Jiangfu, Vishu, that is stomach related point. It is related. Therapeutic Duanxi, that is a stop hemorrhage. Symbolic meaning Long Hui, that is dragon point, 100 beating points. So these are the Chinese name, but we people, we Indians are accepting American name, and there are 12 meridians and 2 unpaired meridians, and 361 points are in their own body. Now there is a clock, organ clock we can call. As I told you, there are 12 meridians. Each meridian has got 2 hours maximum energy flow. Here you can see in liver, night 1 o'clock to morning 3 o'clock. Lung, morning 3 o'clock to morning 5 o'clock. So we are getting most of the cases of asthma during these hours. Morning 3 to 5. Large intestine 5 to 7. Stomach 7 to 9. So there are 12 meridians, and these meridians having this organ meridians having maximum energy during this particular time period. So if you treat this element related to that particular meridian, you can get maximum success. So I'll give some evidence of photographic diagrammatical meridians regarding canines. So this is lung meridian, starts from the thorax and goes on the middle aspect and reaches on the finger. There are 1 to 11 points on this meridian, and highest you can say highest Kai movement will be during 3 to 5. Large intestine, we start from finger, goes toward head. Then stomach starts from head, going toward hind leg. Spleen starts from hind leg, going toward thorax. So one cycle is over. So same type, three type cycle will be there. And here I can say 3 to 5 for lung, 5 to 7 for large intestine, 7 to 9 for stomach, and 9 to 11 for spleen. These are the points on these particular meridians, and each meridian has got all the 5 elements. I can say here metal, water, wood, fire, and earth. All 5 elements are there in each meridian. So you have to select according to the ailment, whether you want to tonify it, whether you want to sedate it, what you want to go for excess, what you want to go for depress, that you have to select. And according, suppose I can give example, large intestine. Suppose constipation is there. So you have to tonify large intestine point. So diarrhea is there, you have to sedate the large intestine point. Now, accordingly, you can go for treatment of ailment. Similarly, this is heart point. Heart, it has got 9 points. Then urinary bladder, 67 from head. It goes toward hind leg, and there are 2 rows here. And in acupuncture, I can say Chun. This is the Chun, 1 Chun. This side is 1 Chun. Around 1.5 each is 1 Chun. So whatever they say, 2 Chun, 1 Chun near the side the spinal cord, 2 Chun side the spinal cord, and accordingly you can go for treatment of the selection of the points. Small intestine 19 points and kidneys 27 points. These are the common points usually used for the ailment. Suppose whatever ailment is there, if particular point is passing through that particular site, you can stimulate or sedate that point, and you can get the effect. This is regarding another 4 meridians. I told 12 meridians. This is regarding triple wormer, gallbladder, liver, and these 4 meridians are there. So total 12 meridians are there. And these are the pericardium, triple heater, gallbladder, liver meridians, and most important points on these meridians. I told 12 paired meridians and 2 unpaired, that is 1 governing vessel, that is on the dorsal side of the body, and 1 conception vessel, that is on the ventral side of the body. And these are the common points used in this on these meridians. These are regarding horse meridians, acupoints, and it is very well used in Western countries for the chronic back pain in horse. This schematic diagram how Chi is flowing in all 12 meridians with timings. These are the common acupuncture points used for variable pain, stress, and locations. So I can say here, you can very well visualize here. These are the points by how we give Ashirwad here. This is Ashirwad point. At this point, 100 points are meeting. And what are elements are mostly when suppose in allopathy we are having some treatments, Ramban Ilaj, that suppose case is coming, we are giving tonic, we are giving antibiotics. So this acts as a tonic. Any ailment you stimulate this point, it will give some results. Similarly in animals, these are the Baiho point, and this point is known as 100 beating point or Ashirwad point. This is the machine used for the electro stimulation, and there are various types of machine available. What happened? Okay, so this machine is available in portable, battery or bipolar stimulation and frequency ranging from 1 to 2000 ohms. So why this acupuncture is used, and most of the cases we are using in many ailments in chronic back pain or especially paralysis, resuscitation of small animals, even treatment of ancestral guilts, sows, bovine reproductive diseases, canine whatever problems can be treated with acupuncture. Mostly it means when I was doing acupuncture in on Veterinary College Anand, we have some trials also, and this is the most important acupuncture point, GV26, Jenchung point. And when you have any problem, over anesthesia is there, animal goes to collapse, I can say this is a one additive ailment, very additive treatment side. You don't deal sole treatment. In spite of giving doxapram, if you go for this, and if nothing is available, you can try this Jenchung point, GV26 point. It is I have shown the location here, 1/3 and 2/3. It is right. So here, if you give our hypodermic needle 24 gauge needle and press it, if you give in anti-clockwise direction, there is difference. If you go for clockwise direction, there will be sedation. If you go for anti-clockwise direction, it will tonify the point. So you will go to anti-clockwise direction whenever you find any case resuscitation, and we got 70% success by using this point. So I just now told there is difference in tonification and sedation. Tonification, electrocution, you have to use low voltage, the threshold of perception, low frequency 2 to 15 hertz, indicator of chronic problems, and there is release of methamphetamine. And similarly for sedation with electrocution, it is quite reverse. High amplitude of voltage is required, high frequency is required, indicated for acute problems, and there is release of dinorphin. In the tabulated form, what to do in tonification and what to do for sedation. You have to prick during expiration. Here, you have to prick during inspiration. I told you that is rotate the needle counterclockwise for tonification. Rotate the needle in clockwise direction. Prick along the direction of meridian. I told that lung 1 is started from thorax going towards finger. So it will prick in the direction of meridian if you want to tonify it. Against the direction if you want to sedate the point. Acupuncture versus acupuncture and autonomic nervous system. It gives visceral cutaneous reflex. I just now told regarding sympathetic effect of GV26, that is Jenchung point. Similarly, most important point is parasympathetic. For getting parasympathetic effect is ST36, stomach 36. That is stimulation, reduce cardiac output, effect blocked by atropine. And acupuncture increase temperature too. Neurophysiological involvement in acupuncture. All major processes of acupuncture require neural partition. It is nervous origin. Anywhere if you give acupuncture, it is related with the motor nerve endings mostly. And main component includes nociceptive A delta and C nerve fibers, muscle spindles, and autonomic fibers. How this will induce analgesia? I told that neuroimmunological factors are there, bradykinin and these type of substances are released, and this will brings about analgesia. Just now I told meridians usually follow the main nerves. Acupoints are closely related to nerve branches, mostly motor nerve endings. How we can say that nervous theory can be applicable? If you go for local anesthesia or local analgesia, you will not get acute analgesia. After local anesthesia, you go for pricking and wanted to have an analgesia, it will not produce analgesia. You will go for nerve block, you will not able to produce analgesia. If you will go for spinal block, you will not get analgesia. And it depends completely on peripheral sensory receptors. Especially between points and the area of analgesia. Lung 6 and triple valve 8, it passes. If you want to anything required for the thoracic region, you can stimulate or tonify this area as per your requirement. Spleen 6 and stomach 36 on the hind limb. This stomach 36, the spleen 6 on the middle aspect, on the lateral aspect, stomach 36 for abdominal and hind limb. So if you want to go for want analgesia of thoracic or abdominal cavity or hind limb, you have to sedate this point, stomach 36 and spleen 6. Humor neuronal theory, I just now told that enkephalin opioids are released through acupuncture. And how you come to know that it is a acupuncture related neuronal theory? If you give antagonist of opioid, that analgesia is abolished. And if you take blood from this donor and give to recipient, even minor degree of analgesia is possible in the donor recipient animal. So cross profusion studies, even rat, rabbits, dogs and monkeys, CSF, serum and blood, you will find opioid levels. The same area of analgesia is observed between the donator and receptor. Elevation of the withdrawal syndrome, even means alcohol withdrawal, narcotic addicts, acupuncture is treatment, and the people are away from this addiction, alcohol and narcotics. It has been found. Endogenous opioid antagonist, not in all stages of acupuncture can reverse by opioid antagonist. Effect is frequency dependent. I told that low frequency is there, high frequency is there. Low frequency will release enkephalin, high frequency will release dynorphin. So methamphetamine low frequency is released and dynorphin is released in high frequency electrical stimulation. Mom, I can understand this maybe means over the head you have missed, but I want to ignite you regarding acupuncture. Otherwise, topic is so much dry that means. This just I can give you are understanding acupuncture, what is acupuncture, what is electroacupuncture, and if you want to increase your knowledge, you just go to the site and you will get more knowledge regarding acupuncture, and then you can understand why this acupuncture. Whenever we go to doctors for our checkup, also immediately there will be blood pressure shoots out. Going to even we are having normal blood pressure, but going to a doctor, there is increase in blood pressure. Similarly, there is stress whenever acupuncture is to be given. So strange environment is there. Insertion of needle, just like fear of injection. Electrical stimulation will be there, and there is increased endorphin and ECTH and cortisol. So there will be stress in acupuncture. So I just told, whenever you select any patient which is who is under control, especially dogs, pets, please sleep. If he is able to order your charging, then this will be working. Otherwise, it will not work. Surgical analgesia can be produced in interaction between science and acupuncture, and it is usually used for soft tissue surgery. It is not used for limb surgery. So if you want to go for soft tissue surgery, that is abdominal surgery, you can very well use this acupuncture by sedating stomach 36, spleen 6, and what are points coming on the way of this surgical site. If you select that site, definitely you will be able to produce analgesia. Even I was not believing before going to China, before going to Brazil. They are doing wonderful things. I have seen cesarean section under acupuncture analgesia. I have seen many disease ailments being treated by acupuncture in Brazil. And if we can, means scientists can take interest, even in Navsari, we have acupuncture machine, even Anand, we have acupuncture machine. But most of the time, we are going not for analgesia, we are going for a treatment of paralysis, chronic back pain, and it gives wonderful results. If means that particular technique is followed, where to sonify, where to sedate, which point is selected, and then you can get the result. Otherwise, there may be problem. And I already told it is not sole treatment. It can be act as an adjunct treatment, additive treatment. Acupuncture analgesia, you must have sedation. As in acupuncture, will not get muscle relaxation. Similarly to ketamine, ketamine will not produce muscle relaxation, and that's why we are using with diazepam. So any benzodiazepam can be used before acupuncture. That particular site should be fully pitched. There will not be any noise. You should cover the eyes of the animal. There will be hypoalgesia, not anesthesia. Animals or human is completely conscious, and protection reflex are maintained just like ketamine. In acupuncture-induced analgesia, disadvantages are you cannot go for intubation. Individual effects, you may get result, you may not get result. If you will not get result for a surgical analgesia, you need to switch over to chemical analgesia. Prolonged time to effect, presence of electrode wires. If you go for electroacupuncture, and there is no muscle relaxation. Of course, it is cheap, no pharmacological depression, no side effects, just like chemical anesthesia. There will be cardiorespiratory stability, less bleeding as being reported by Angeli in 2001. Better healing, it's questionable whether it is due to acupuncture, whether it is due to electric stimulation, or what other else, it's still questionable. Quick recovery, residual analgesia, less post-operative complications like ileus, urinary retention, nausea, vomition, appetite. Acute analgesia, I already told that little effect will be there on limbs. It is better for soft tissues. Females more means we are getting good analgesia as compared to males. Canines, we are getting good analgesia as compared to felines. And behavior of the animal is very important. Animals should be calm, quiet, and easy to understand your orders. Then and then that acupuncture works. These are some of the studies regarding acupuncture-induced analgesia for cesarean section in which this is from Brazil, and they have studied electroacupuncture versus inhalation anesthesia, and they have found that neurological reflex tended to be more evident in puppies born from bitches under electroacupuncture analgesia as compared to analgesia produced by inhalation anesthesia, producing less cardiorespiratory and neurological depression in the newborn. I already told, and frequently I am telling you, that individual variations should be considered and use of muscle relaxation. It is complement to analgesia. I can see that with electroacupuncture, it will reduce MSC MEC by 70% and halothane MEC 11 to 17% if you use electroacupuncture with inhalation anesthesia. This is a study in Brazil in 2001, and they have divided 30 dogs in 5 groups. 0.1 milligram acetaminophen subcutaneous in group 1, 1/10 of acetaminophen diluted to 0.5 ml saline, injected at acupuncture point in tongue, just in between the eyebrows here. 0.5 ml saline injected in tongue, 0.5 ml saline subcutaneous at neck region, and 0.01 milligram per kg acetaminophen in false acupuncture. These are the 5 groups, 30 dogs, 6 animals in each, and they have given induced anesthesia with thiopentone sodium 2.5% until absence of pedal reflex. These are in-turn point. So what they found in 0.1 milligram acetaminophen group, 50%, 51% dose of thiopentone is reduced. 0.01, that is acupoint, at intang, mixed in 0.5 ml saline, 32% of the thiopentone dose is reduced. See here, 1/10 of the acepromazine is there, and 32% of the thiopentone dose is reduced. False acupuncture point, 23% thiopentone dose is reduced, and saline intang 10% reduced. So it will definitely potentiate the effect of thiopentone anesthesia intang point. Acupuncture analgesia in chronic pain and post-operative pain is very important, and I told that it can be used if nothing is available with you. Suppose you are treating any case, chronic pain is there, you are treating with analgesic and everything, and now there is no way out, you can think of analgesia with that particular analgesic drugs. And this is regarding one study, acute analgesia, unilateral, we can go for unilateral, bilateral or false point stimulation, and 8 dogs each, and they have studied in 2001. These are the points, real versus false point. These are the points selected. So what they found, unilateral versus bilateral versus false acupoint. Acupoint stomach 36, Susanli, gallbladder 34, I already shown you on the previous slide. Spleen 6, this is the stomach 36. This is spleen 6, GB 34. These are the points. And electrical stimulation was given. And they want to check evolution analgesia, level of analgesia, somatic analgesia by thermical stimulation, thermoalgimeter probe at 52 degrees centigrade on skin, and mechanical stimulation with forceps for 10 seconds. And they have divided these sites, and they given 1 to 12 numbers, and 0 no response, 1 slow response, and 2 quick response. This is regarding thermal checking. These forceps, pressing with forceps, the interdigital space thermal checking. Even for visceral reflex, what they do, they lubricate Foley catheter, introduce from rectum to descendant column L7, cup inflated with air until reaction, maximum 60 ml of volume is to be injected, and this is regarding a Foley catheter, insertion of Foley catheter up to the colon L7. What they found, bilateral versus unilateral electroacupuncture. Bilateral electroacupuncture is shorter time to effect, more intense analgesia, no cardiopulmonary respiratory exchanges, no stress has been depicted from the cortisol level, and false electroacupuncture, there was no effect. Acupuncture for, as it is for, I'm while considering this is for surgical related surgery. That's why this is regarding chronic. Otherwise, it is used for reproductive system also very well. And we have one project with Dr. Ajisa regarding use of these enzymes, hormones at acupoints, and that gives results also. Acupuncture for chronic and acute pain, local anesthesia, point close to the region. The site affected, if you select that point, nearby point, it will give more result as compared to distant point. Points from the region that crosses the area. These are the head points. I already told there are 361 points, and there will be 44 extra points. These are the points on the head, and you will get all the charts, all the material from IBS, International Veterinary Acupuncture Society. It is a official site, and you can get most of the information from that particular site. This is regarding for thorax. You can go for stimulation. For abdomen also, I told that ST36, stomach 36, spleen 6 can be stimulated. For limbs. So just like master points, when our treatment, allopathic treatment, we give antibiotic, we give tonics. Some of the points are master points. Suppose if any ailment is there related to bone, you can select bladder 12 points. Face and throat, LI4. If you got headache, I can say this is LI4, Kuchi point. Highest point on the palm. If you press like this, I can say your headache will be relieved. Suppose there is means vomition is there, transport vomition. This lifeline is there. You can do like this. This P6 point, pericardium 6 point. You press it like this, and you can get relief. This is acupressure, P6. Similarly, this Kuchi point headache is there. If you stimulate for 20 to 30 seconds, I can give this bet that you can have some relief. It may be, it may not be sure that you will get relief, but maybe psychologically you feel, oh, I got relief. So LI4 is face and throat, pericardium 6, thorax and abdomen, abdomen and gastrointestinal tract, stomach 36, posterior abdomen, genital and urinary system, spleen 6, tendon and ligament, gallbladder 34, neurological problems, just like aspirin, bladder 60. Lumbar pain, Bahu. Bahu point in the animals are at two sides, at lumbosacral as well as this acilar point. That is known as Bahu point. It can be used for chronic conditions, paralysis and hypalgesia. I told this there is indications are there. At the same time, similar to allopathic drug, contraindications of acupuncture are also there. Cardiac disease, epilepsy, fever, pregnancy, acute disease, injuries, and it will not be a salt treatment. It will additive treatment. It will not be effective in all animals or all human beings. Advantages of electroacupuncture are less time consumption, standardized treatment, more uniform stimulation, simultaneous stimulation of several needles. Stimulation may be adjusted. As per the physiology point of view, there will be electrolysis, electrophoresis, tissue ionization, and local pH changes with electroacupuncture. There will be electric burns, excessive stimulation, electrodes placed too close, obesity, scars, and dermatological disease can be found after electroacupuncture. These are some of the cases treated by me. This is a case from Naswari, well-known actor Farooq Sheikh. I used to go there and treatment was given. This is the horse lying down, and after 3 sittings, animal started standing up and started walking also. This is an aquapuncture I have done, that gallbladder point. So these are the some of the cases. I don't have that much of photo. It was in Anand. Whatever things are there in hard disk, I was just showing it. These are one peacock. This is when peacock arrived in the clinic at surgery department, veterinary college Anand. We were given 3 sittings, electroacupuncture, and that peacock started walking. So after this powerful presentation, at least I have just ignite you regarding acupuncture. What is acupuncture? What is electroacupuncture? How it works? I try to explain the things. I was even during my PhD, I was getting some results. I was not getting my results. I was keeping ready xylazine also if I'm not getting results during any clinical cases. But in experimental cases, I used to have some of the very good analgesia, and we perform surgery also. In some of the cases, I didn't get analgesia, I would switch over to chemical anesthesia. So it is not a sure, as I was doing in street dogs. If animal is pet, obey to your orders. And if you go for acupuncture analgesia, it will give results. I have seen my eyes also in China, in Brazil. So if we scientists, we doctors, and if you become member of IBS and Western medicine follows, and just have more knowledge on acupuncture, I am sure whatever treatment fails with allopathy, we can try acupuncture, and there may be miracle, there may be magic, there may be fantasy, and being a real science, we may try. Now it is up to you to decide whether we should start acupuncture in our practice or not. But after igniting this presentation, if you have any questions, of course, since last 10 years, I am not doing any acupuncture practice in Anand. I was doing, but that was also sporadic cases. Even I went for treatment of one of our secretary, ex-secretary dog in Gandhinagar, and wherever I find some animal is pet, I obey to orders, and I was trying, and I was getting results in some of the cases. Some of the cases I was also not getting results. Maybe I was not that much expert at that time. Even today I am not expert. Each and every case is different, and if you want to expertise in your field, this acupuncturist treatment in Brazil, I have seen 50 cases in a clinic in a day, 50 cases. And every ailment patient is coming for acupuncture, regularly coming. So when I went there, I was started believing that it works. How it works, that I already told, there are various therapy, neurobehavioral theory seems to be very feasible and well accepted. So now it is up to you to decide what to do. So 1,000 mile, I can say infinite mile journey starts with one step. And I'm sure that I have started to have one step towards thinking on acupuncture. And if you feel so, we can have acupuncture in routine practice in sporadic cases. Thank you. Thank you very much for giving me opportunity. Thank you very much.
Around acupuncture.
So it is just hypnotized lecture, maybe.
Yes, sir. It was a very new topic for us also.
Yeah,
and now the topic is open for discussion. Sir, first of all, I
Yes.
want to know the full form of the website you have told about the acupuncture, that is the IBS.
IVAS, International Veterinary Acupuncture Society.
IBS.
I had given in my talk in paper also.
Okay,
I
sir.
had, I had given, and some of the reference I will share with you. I will send today to Shivaji, and he will give some reference to you also. That will be shared to you, all of you.
Okay, thank you, sir. So nice of you. Now the topic is open for discussion. If there are any questions or queries.
Sir, good morning.
Good morning. Good morning.
Namaste, sir.
Namaste.
So since last 25 years of clinical experience,
Yeah.
I definitely say you, at the time of my PhD, you are just coming from Brazil, and you used to teach us on the acupuncture, but I didn't go in the deep knowledge of the acupuncture. But I can say, on my experience, I saved hundreds of dogs and cats on that GV26 point, and number of students are also in all the institutes. They are, the supportive us, sir, what you are doing. So I just say only GV26. If you want to go, you can go, but nobody is going inside. But I can definitely say GV26 definitely gives a magic. I don't know what it's happened, but dog and cat, those who are going the cardiovascular, any type of shock, suddenly you're going to die or gasping, they can be reversed like magic. Thank you, sir.
Sir, in addition to Talekar sir, I also submit that me and Dr. Shivraj Jala is till date going for GV26 whenever anesthetic emergencies arise. And due to that, whatever you gave us knowledge about the point, we are trying to save the life of the dog or pet, sir. Thank you, sir.
So if you can save life, one patient with GV26, my lecture is means I can get the means what want from all of you. I got feedback that you all will save the life of the patient whenever research is required. GV26, GV26. I'm sure even we have given 3 times. Dr. Arish Bhatt is there, and with my PhD, 3 times thiopentone dose. Animal was apneic for 2 minutes, and then we have given GV26. That animal revives. So 3 times the dose of thiopentone sodium, animal revives after 2 minutes apnea. So it's a very good point. If you go in field, if you try anywhere, but I am giving cautious and caution to all of you, don't 100% rely on that. Sometimes, if your point not exact, you'll divide one third and two third. At this point, it is GB26. So if you'll go for stimulation of this point, anti-clockwise direction, I told you, if you go for clockwise direction, it will sedate. So if you want to get sympathetic effect, anti-clockwise direction on GB26, definitely revive the patient.
Sir, we are not believing, but last hope we try. And we
Yeah, definitely, yes, definitely.
Thank you, sir. Thank you. Indirect blessing from animals also to you, sir.
Thank you, sir. Thank you.
Any question from student?
Good morning, sir.
Yeah.
I am Dr. Shardul Salvi, PG
Yeah.
second year student from surgery department.
Okay, very good.
Sir, can you tell us more about triple hitter point and which organs are involved in it?
Which point?
Triple hitter point.
Triple hitter point, yeah. Triple hitter points mean there are three cavities in the body, right? So all the three cavities body are involved in that particular point. This is with the pericardium. Pericardium and triple are together. One is yin, one is yang, right? Similarly, just like lung and large intestine, stomach and spleen. Similarly, pericardium and triple, it is affecting all the three cavities of the body. So whenever any cavity body is ailment, you can tonify triple Weber point. Triple Weber 6 is a major point, master point. Whenever any pelvic cavity ailment is there, so there will be combination. You will select stomach point, triple Weber point, lung point. Means where the ailment is there, and on that ailment which meridian is passing, which point is local near to the site of ailment, and which point distal to the site ailment. So near point will give better effect, distal point will give means lesser effect. So selection of point is very tricky, as well as whether to go for tonification or whether to go for sedation. That you will think according to condition. I already told, large intestine constipation is there, you will tonify the point. Diarrhea is there, you will sedate the point. So towards the meridian, against the meridian, that if you go through the complete theory and then you can apply in practical, you will get results.
Okay. Thank you so much, sir.
Yeah.
Okay, thank you, sir.
Thank you very much. Thank you for calling me. Thank you, Dr. Tank, Dr. Shivaji, Dr. Bhatt, Dr. Ansu, and all the staff members of Veterinary College, Junagadh, all the students, all the participants. If you have any query, I want to enrich more regarding acupuncture. Now I am out of the complete textbook and everything, but if you'll give some references to me, I want to learn more, and it's a C. If you get any reference, just give it to me. I also want to know more about it in leisure time. But if you go through this IVS site, you will get all the information, even in for bovines. Yeah, I told that during my lecture, even the reproductive tract, if you give hormones, 1/10 of the hormone at point will give results at acupoint. So it's a science, and it's the Indian science. But we the people, we have not developed. Chinese have developed, and people in the world are believing that it is a Chinese technique. Of course, it is Indian technique. We are having bindis. We are having earrings. Nose means now tattoos are there all over world, anywhere in any part of the body they are having tattooing. That is, even I forgot to tell you one case of hip dysplasia. I have gone for gold bead implant. There is silver bead implant and gold. I think Shivaji was also there, but was also there. Gold implant near the hip dysplasia, and I got the results. But that photograph was not available with me. So there are implantation is there, just like acupuncture. You can go for implant, gold implants, silver implant, and you can get the results.
Okay, thank you very much, sir.
Thank you very much. Thank you all. Thank you, Dr. Tang. Thank you, and all the authorities of Junagadh University. Thank you very much.
Thank you, sir.
Thank you.
चौधरी सर को ले लो लाइन से। डॉक्टर आर्य चौधरी है।
टाइम भी हो गया।
ये बता।
वेरी टाइम।
अरे वो 2 घंटा की
मैं डॉक्टर साहब एक बार प्रेजेंटेशन दे रहा हूँ, डिस्कस कर लेंगे बाद में।
Dr. Arun Chaudhary. Yes, sir. Hello. Good morning, Dr. Chaudhary. Hello.
ऑडियो वीडियो ऑन करने के लिए करें, वीडियो ऑन नहीं हो रहा।
Hello.
नहीं आया तो नहीं ना,
लेना चाहिए, देखते तो सही इतने दिन के बाद। कैसा है इसका हेल्थ वगैरह? अच्छा, बेटे का?
फेसबुक में फोटो मूके रखे।
हेलो डॉक्टर चौधरी, याद करेगा हिंदुस्तान के राजी से क्या?
ना ना हारो चल रहा है।
हेलो
हेलो, गुड मॉर्निंग डॉक्टर चौधरी।
शिवाजी सर।
हाँ, गुड मॉर्निंग सर। अच्छा,
गुड मॉर्निंग सर।
वी आर वेलकमिंग यू।
सर डॉक्टर दीपक तिवारी हियर सर। वॉइस आ रही है सर, वहाँ क्लियर है?
हाँ भाई, सारे आप चौधरी सर को बोल दो।
हाँ हाँ सर, चौधरी सर मेरे साथ ही हैं सर। बाकी वीडियो सर डिस्प्ले हो रहा है?
नहीं, आपका नहीं हो रहा है, पहले हो रहा था।
वीडियो नहीं आ रहा है सर अभी।
हाँ, आपका डेस्कटॉप का चालू कर दो।
नहीं नहीं, मेरा नहीं सर, चौधरी सर के साथ ही हूँ मैं। सर दिख रहे हैं क्या आपको?
नहीं दिख रहा है।
ये आता नहीं। आरएनसी तो
तुमने कॉपी मोकली सर? कामधेनु हॉस्टल तात्कालिक
आपने ज्वाइन कर रखा है क्या?
हाँ कर दीजिए
मैं उसी पे
हाँ बरोबर.
सर वी आर शिफ्टिंग टू अनदर कंप्यूटर प्लीज.
Yes, yes, okay. BCC मामले में क्या नहीं दे.
हेलो शिवाजी सर
हाँ दिख रहा है. गुड मॉर्निंग.
गुड मॉर्निंग थैंक सर
140 को 145 को 135 को टूकમાં સિવિયર શોર્ટેજ છે એ ન લે ક્રોસ.
Sir, Dr. Chaudhary sir will join and deliver his presentation from this desktop, sir. He is coming because he is facing some problem with this system.
No problem.
Good morning, sir.
Good morning. Tank sir is with me. Hello, Dr. Tiwari, how are you?
Fine, sir. आप कैसे हैं?
How I am looking there?
Sir, I am in Hisar, sir.
Basically, I have gone bald now. No hairs on the head.
Yes, sir. Yes, sir.
I am happy and all the faculties at Junagadh are equally in the same winter mood.
Yes, sir.
Dr. Chaudhary is accompanying you?
Yes, sir. He is here only, sir.
Please. Where you are holding this time a symposium of the surgery society?
Sir, this time we have decided to hold it at Pantnagar, but due to this COVID pandemic, it has been postponed, sir.
Virtual mode you can prefer.
Yes, sir. That executive committee meeting will be likely in this month, and then we will decide what the next probabilities for holding this conference.
Assign it to Dr. Shivaji, who is now competent to arrange this virtual vocational training of 5 days. So 2 or 3 days symposium will be easy for him. All system is
Yes,
ready.
sir. Definitely, sir. We will take. Yes, sir. Definitely, we will take the help of Dr. Shivaji and his team, sir. He is doing well, sir. And nicely, they have arranged this training, sir.
We will arrange for 3 days symposium virtually.
Yes, sir. We will plan like this, sir.
We have all IT setup and the mindset also.
Yes, sir.
Of course,
सर उसके बाद भी हम चाहेंगे सर जब फिजिकल खुलेगा सर तब भी एक जूनागढ़ में सर ISBS एक होल्ड करे सर जब तक आप हैं आपके नेतृत्व में.
ना नेतृत्व तो शिवाजी का ही रहेगा. I am now not in the department surgery. We have to look into all, but we wish that Shivaji will organize and we will support him.
Yes, sir. Definitely, sir.
Though our college is an upcoming institute, just completed mere 11 years, we have now just come out of the cradle and trying to run with a sound footing. Line up Junagadh in a queue of ISBS organizing.
बिल्कुल सर.
If you are thinking of virtual arrangement, we will be able to do it instantly. Physical arrangement, we may take 1 or 2 years. We have accommodated national conferences in different subjects, but physical arrangement, we may have to wait for 2 years because other subjects are in queue. Virtually, we can arrange instantly with a gap of some 10-15 days notice. We'll be able to do it as we are doing vocational trainings in different disciplines under IDP over a period of last 2 years. This is probably the 13th vocational training, and this is 4th or 5th virtual vocational training being arranged
during the year. So our setup and all are ready with the help of all the members and the executive body. Probably it will be easy and to facilitate from Junagadh, and you can think of.
Yes, sir. Yes, sir. Yes, sir. I heard about that. Also, sir, that was a good feedback. Sir, whether this PPT is visible?
Hello, Dr. Chaudhary, how are you?
PPT is visible?
Chaudhary.
Yes, yes.
Fine, sir. Namaskar, sir.
Good morning, Chaudhary sir.
Namaskar, sir. Good
Good
morning,
morning,
sir.
good morning.
I request chairman, co-chairman of the session.
Okay, so we welcome Dr. Arvind Chaudhary, Associate Professor, Duvas, Hisar, Haryana, at this morning session of the 5th day of this vocational training. And he's going to present on diagnostic radiology in large animals. And before he starts presentation, let us have his brief introduction. So, Dr. Arvind Chaudhary is working as an associate professor in the Department of Veterinary Surgery and Radiology of College of Veterinary Science, Hisar, of Luvas, Hisar. During his graduation from Veterinary College, Mathura, the best performance in study and allied activities, he was awarded Chancellor's Gold Medal of the university. He was also bestowed with all other gold medals designated for any single batch, like Best Veterinary Graduate Gold Medal, Dr. R.P. Singh Memorial Gold Medal, Dr. S.L. Kulshekara Memorial Gold Medal, Pfizer Veterinary Gold Medal. He also qualified GRF and SRF exams of ICR New Delhi with good ranks at national level for pursuing MBSc from CCHSHAU, Hisar, and doctorate from Duvas, Hisar, respectively. Dr. Chaudhary started his career as surgeon in private pet clinic at Chandigarh in 2003, but his passion for learning and teaching made him to join Sher Kashmir University of Agriculture and Technology as faculty in 2005. Besides teaching and research activities of the department, he was actively involved in monthly camp duties at the base camp of Mata Vaishno Devi Shrine for the treatment of horse and mule, and his team was awarded gold medal for best research paper in equines and treatment of eye affection of horse in 2006. Then he joined Luvas Hisar in 2009. His dedication made him popular among the farmers and veterinarians. He popularized many techniques in the treatment of large animals like tube cystostomy in buffalo cows, then examination of glans penis for uroliths in bullocks, before post-scrotal urethrotomy, IV injection, xylazine ear vein for sedation and restraining. He has introduced use of sevoflurane for anesthesia of buffaloes for the first time and was awarded gold medal for best research in anesthesia by ISBS in 2016, and then also in 2019 for pioneering the use of etomitate in buffaloes for undergoing diaphragmatic herniorrhaphy. He has also developed indigenous portable low-cost endovision device like endoscope for examination of upper gastrointestinal respiratory tract of large animals, which is suitable for the field condition. He has published more than 75 research and clinical articles in different scientific journals of national and international review, authored chapters in 3 textbooks, many popular articles in magazines and newspapers, and presented more than 100 research papers in different national and international conferences. He has delivered 7 talks on diagnosis and treatment of foreign body syndrome, especially in diaphragmatic hernia and bovines, as an expert on national level training programs. Recently, Rotary Club Hisar has bestowed him with National Builder Award for 2020 on the eve of Teachers' Day. So, with this brief introduction, I now would like to request Dr. R.N. Chaudhary sir for the presentation on diagnostic radiography in large animals.
Thank you very much, sir. Very good morning to Honorable Dean and Principal of the College, Dr. Taksar, all the respected faculty members,
and all the delegates who have joined this virtual training program. So I am going to present the today's topic, which has been assigned to me, diagnostic radiography in large animals. When we say diagnostic radiography or diagnostic radiology, in nowadays in present scenario, it encompasses a large number of techniques like radiography, sonography, CT scan, MRI, nuclear scintigraphy, and all the things. But these all things has been discussed by previous speakers, by previous trainers. So here I have to stick mainly with the X-ray, what radiography or X-ray, dealing with mainly X-rays. So if we see our present scenario in Indian condition, radiography is still one of the mainstay for diagnostic imaging in large animal referral hospitals like we have in our institutions or all other veterinary colleges, polyclinics, and even some private institutions. So still in large animals, for large animal radiography is still one of the mainstay, or you can say main diagnostic imaging tool which is being used. It is being contemporarily given a challenge by the sonography, but sonography cannot replace the radiography because they can supplement each other, but they cannot replace each other. In sonography, we know that we can go for real-time assessment of any, especially the visceral organs. We can see the texture of the organs, especially soft tissues and the blood vessel presence and the blood flow in the organ. But if you want to have a global assessment of the entire organ or entire cavity, like suppose abdominal cavity or suppose a thoracic cavity or a large area, so you cannot have a global assessment at a time in a single view. So for that, if you want to have a global assessment of a large area of any large animal or a small animal, you have to stay for the radiography. And especially the high density tissue, they are better seen in radiography. And the quality in case of sonography is also very much dependent on the sonologist rather than on the machine. So it will be always, sonography will always be better with a highly experienced. However, in case of radiography, only the factors, positioning, animal and the machine, they are the responsible for the quality of the radiograph. So we can say that sonography will supplement the radiograph or radiography will supplement the sonograph, but they cannot replace each other. Now in radiography, when we call for nomenclature, here there are three things are included. Suppose the organ of the animal, origin of the animal, positioning, and the area from which the X-rays penetrate. We usually give the nomenclature as per the penetration of the ray, from which side the ray penetrates and from which side it exits out. So to establish a imaging section, we can say that for any establishment to have a long run, we should need some basic things. Whenever a case is reported to OPD, first of all, there is a registration in OPD and it is examined by either physician or surgeon. Then if the physician or surgeon desires the requirement of X-ray diagnosis, then he fills up a prescribed proforma and sends it to the X-ray section. And in X-ray system, entry is first made in the CR, that is computerized radiography imaging processing system. That is very easy nowadays to keep it in a long way for longer duration and a bulk data, a big bulk of data. So X-ray is done and imaging process in the CR system, and whatever the report it comes, it is stored in the short form as well as in the hard copy given to the owner, and record is maintained in the register also. So this is how our X-ray system runs. Then beside this, to run the X-ray in large animal cases or small animal cases, we should have a stock register, inventory register, subsidiary register, and logbook for each machine, so that we can have look over or supervise our equipment, their failures, and in a long run we can calculate the everything. This is the pro forma we usually provide in our clinics, where there first these owners and animal identification and addresses are given. Then a brief history is also needed, is always needed before interpreting a radiograph. So a radiologist, before interpreting a radiograph, a brief history and clinical examination by the physician and his tentative diagnosis is to be given. Then he writes the area to be radiographed and what view he desires, his name and his signature. Then it comes to the radiology section, and in X-ray section, our radiographer or technician, he fills up the factors he used, and ultimately, when the image is processed, so it is any of the faculty, expert faculty member, they give this interpretation and with their signature. However, this is not a retro-legal document, but here this supports the what printout of the radiograph we give. This supports the physician what is the interpretation of the radiologist. Now, if we see that how to go for equipment and how to prepare the animal for the X-ray, if we see the X-ray tube, as we know that it was invented in 1895, and since last over 120 years, you can say there is no basic change in the principle of the X-ray tube. Still, the same type of X-ray tube is being used. Only the capacity may be the different. The strength of kVp, MAS, they may be the different. However, the principle, what the Roentgen has used, the same type of, similar type of tubes are still being used. But this year, in the virtual meeting of this North American Radiological Society, they have presented a new type of X-ray generating system, what they call it a cold cathode X-rays, that a company from Israel, NanoX, this Nanox company from Israel, it had developed a Nanox ARC next generation cold cathode X-ray. It is a chip-based system, a silicon chip which operate in a heat emission type cathode, or we can also call it cold cathode. Means here you have not to generate a lot of heat by three-phase voltage, and so that the life of the machine or the life of the tube will be thought to be much more longer, and it will be easier to carry. It may be, if this technique will be commercial, then it will be easier to carry. They have this developed this prototype Nanox ARC next gen cold cathode X-ray, and as well as we can say that they have made the chip are very small in size. In 1 centimeter of size, you can say that they have this patented technique MEMS, this microelectrical mechanical system. So they have patented in 1 centimeter size, they have millions of this nano gate or nano holes, gate holes, through which the electrons come in a electromagnetic field. So with this invent of this technique, I think there will be a drastic change in the radiographic procedure as well as its utilization. It will be enhanced in a much more way, and it will be more mobile, more portable. Otherwise, nowadays you can see that we are basically using ceiling-based our large animal radiograph. Basically, most of the institutions have 600 mA, 500 mA, or more than 600 mA. We are also just going to purchase 1000 mA X-ray machine. So, if this technique, cold X-ray technique, this comes, then this will enhance our this radiographic capacity a lot, in mobility also, in portability also, and in the, you can say, the machine size will be too small and it will be more durable. So beside this control panel and the cassette, here you can see the cassette. So we need our this control panel. So in control panel, you can see there are settings for the MA and KV, and this along with time setting, it comes to MAS. So this is a control panel for 800 MA machine. And after just taking the radiograph, we come to the, this is our computerized radiography system, where this is image acquisition system, and this is printer, and this is the monitor. However, when we have to demonstrate to the students, then we can go for the connected with the LCD system so that it can be visible, the radiograph which has been processed can be visible on a large scale. So these are the equipment. This is the consoles how we feed the data of any animal which has been reported for the radiography. Then for being in large animal practice, if you have to go for radiography and you have to give, as I show you the performer where the physician or surgeon who wants to have a radiograph of any animal, then he has to prescribe the part as well as the view, which view you want. Because you are the person, you know the better that which organ is affected, which bone is affected, or from which angle it will be better to view. So in for just having a basic, everybody has this basic idea, just to replace it, that we can ask for this is craniocaudal, if this is cranial side, this is caudal side, if X-ray is penetrating like this, then this is craniocaudal, this is dorsoventral, means back to spine to abdomen, this is dorsoventral. In limbs, especially below the knee and hock, in forelimb we call it dorsopalmar, in hind limb we call it dorsoplantar. Similarly, if you have to take radiograph from the chin to forehead, then we have to call it rostrocaudal. Accordingly, we can go for either a straight radiograph or oblique radiograph. So for oblique radiography, the X-rays which penetrate from this ray, we call it dorsolateral palmaromedial oblique 30 degree. Here we have to write DL 30, means from lateral it is 30 degree oriented, and this dorsolateral means lateral to dorsal to the lateral side, it will penetrate the X-ray and it will exit from the palmaromedial side. Similarly, if it is entering from the dorsomedial aspect, then it is known as dorsomedial palmarolateral oblique 30 degree. So this is how you have to go for either this is dorsopalmar or this is dorsolateral palmaromedial oblique. So this is how we have to go for prescription on the performer, so that the technician or the radiologist, whoever in the X-ray section, he can understand your point and go accordingly. Now in positioning, just I will show the few positions which are very common we usually take. This is the best position we go for usually, the radiography of reticulodiaphragmatic area. Basically, when we suspect for any foreign body, so we go for radiography of this area. You can see it is just below the sternum and the last of the thoracic part, as well as cranial portion of the abdominal part around this costula. How we place the cassette, and also you have to place a grid. Whenever any thickness is more than 8-10 centimeter, we also go for always placing a grid over the cassette to reduce the scatter radiation and have a good image. But nowadays, since this recumbency of animal, an animal is always afraid of the setup of the X-ray system. So for during this training, many a time we feel much more difficulty, and lot of people, 5-6 people are required. Sometimes sedation is required. Sometimes there is chances of injury or damage to the machine by the animal also. So in 60-70% of cases, in case of diaphragmatic hernia or foreign body syndrome, what we do, we are taking, when the size of the buffalo is less than 400 kg, approximately 350 kg or 400 kg, 70-80% of cases we are going for standing animal radiograph, and we are able to diagnose. So this is also a, you can say, it is classically mandated that you should go for lateral recumbency, either left or right. However, for the foreign body syndrome diagnosis during the large animal radiography, however, if you have this CR system or direct digital radiography, then you can also go for this standing animal radiograph, because as this processing system of the radiography, the data processing has improved either in case of CR or even more in case of DDR. So we can acquire the image even with least radiographic capture. So to avoid this collection of human being, because these X-rays are also injurious to human being, and sometimes owner are alone or there are only 2 people. so they are not able to restrain the animal. So 70-80 to diagnose. In case of here we just the one limb of the animal of one side from the outward. Just one elbow region.
Hello.
Hello.
Hello. Shivaji sir.
Yes, yes, please, sir, continue.
Yes, sir.
Share for screen.
Sir, please enable us to share the screen.
Yeah. Screen share करो. सर आपका स्क्रीन शेयर करो.
Yes, sir. Yes, sir. सर कहाँ से कटा था?
हाँ बस वो वाला.
यहाँ से शुरू करें?
यही है. हाँ पोजिशनिंग वाला.
Okay.
सेम.
Sir, whether it is full screen?
Yes. अनम्यूट कर दो. गिरा.
So I was talking of radiographic positioning. So this is the ideal position we take for the foreign body syndrome to have a cordoventral thoracic and cranio-ventral abdominal approach. So here you have to make the animal recumbent and put a cassette within the case. We have the polycarbonate case in which we put the cassette, and above that we put the grid. So whenever there is more thickness, means more than 10 centimeter of thickness, it is always recommended that to go for grid to reduce the scatter radiation. So nowadays, because that recumbency of the animal, lateral recumbency of the animal always required so much struggle, and it was slow in process, but there are lot many cases. So nowadays what we are doing, we are going for a standing animal radiograph, and in 70 to 80% of cases, this standing animal radiograph by this way, by retracting one limb forward and pushing the cassette inside the elbow region, and by this way we are able to diagnose 60-70%, 70 to 80% we can say the cases of foreign body syndrome in large animals. These are the other views like elbow joint, where we are having from the lateromedial view of this elbow joint and the upper radius ulna, similarly here the mediolateral. So as I told that it is from the point of X-ray which is entering the organ, and from the exit we are giving the view and we write the region which is required. Now this is the normal view. I will just show the common views which are usually in practice. This is the normal view for pharyngeal radiograph or upper cervical region for the foreign body or any other changes. Then these are the, here what I was telling, this dorsoplantar view. Most of the time when we take the radiograph of the fracture, and many a time only single view is taken, but we always take two views on perpendicular to each other, that orthogonal views, so that we can have the complete picture of this fracture or limb abnormality, whatever it is. So for orthogonal view, this is the dorsoplantar view, however this is the mediolateral view. Similarly, this is for the hock joint, this is for the stifle joint. So in this way, if you have to go for seeing some changes in the nasal cavities or paranasal sinuses, so we can go for having this dorsoventral view. Similarly, for the forelimb, this dorsopalmar view. And if the animal is small, like heifer of the large animal, a single cassette of 14/17, we have three size cassette, 6/8 and 10/12 and 14/17. So if we have this small animal, the single cassette is sufficient for entire thoracic cavity. However, later on I will say that we take four views of the thoracic cavity, that is craniodorsal, caudodorsal, cranioventral and caudoventral in case of the adult animals. Now we will see some radiographs, so some common radiographs in large animal. Here you can see the fracture in the mandible, which is very common. So for this we have to take the lateral radiograph of the mandible. So this is here you can easily appreciate the fracture, and this is the cortex has been discontinued, and this is the fractured part of the distal part, and this is the proximal part, this is loosened, and this is after the treatment. So radiography in large animal as well as in a small animal, it helps both in diagnosis as well as evaluating our therapy. Now this is a radiograph which is very common. Many time animal come with some foreign body ingestion, and these foreign bodies are penetrated below the tongue, and these are in the intermandibular region. Sometimes thread is also palpable. So this is a radiograph having needle penetrating the ventral region of the tongue in the intermandibular region. Similarly, we can also see the tumors, different type of tumor from the radiograph. You can see here this mandible is involved. This is the bony, this is the calcified area of the tumor. This is the soft tissue of the tumor. So this mandible is involved. So it may be decided later upon by histopathology that what type of tumor it may be. It may be osteosarcoma, it may be a myeloblastoma, odontoma, whatever it is. So in diagnosis of tumors, whether here we can grossly say whether the bone is involved or not, and on the basis of that we can suspect that may be tumorous or not. So in the diagnosis of mandibular tumor also, or the tumors of face region also, this large animal radiography is very much helpful. Similarly, for the teeth irregularities, we can also see that if there are irregularities in the teeth, if there is irregular molars, or if there are some in odontoma if the incisors has been embedded, or sometime also in periodontal disease or the disease of the root cavity or root of this in the gum area of these large animals. This radiography is also helpful. For this, we have to go for the lateral radiograph. Similarly, many times, as I told you, that foreign body injection is there, and 60-80% of these foreign body, they are trapped somewhere in the pharynx at the time of injection. So at the time of injection in the pharyngeal area, you can see here the metallic wire, some metallic wire-like piece here. In the this is the trachea, and esophagus is normally not visible in plain radiograph. Normally not visible in plain radiograph. This is a normal animal radiograph where we can appreciate that this is the trachea and the esophagus is lying somewhere here. And after this, you can appreciate little bit change in the radio opacity of this radiograph, because after third cervical vertebrae, it becomes lateral to the trachea. So esophagus usually is not visible here. So if there is any problem with, especially in large animal, choking is there, many a time esophageal obstruction is there. So we mostly go for barium swallow or barium meal. So you can easily appreciate with help of the barium meal that where is the location of this obstruction, of esophageal obstruction. It may be radiopaque, it may be radiolucent, but after giving this barium swallow, once the barium swallow encompasses it, once the barium swallow overlaps it, so it will be easily visible. So this is somewhere in the proximal cervical area. It may be something, it may be the fibula, dry husk, you can say, or a dry straw, or sometimes leather piece, sometimes cloth piece, sometimes rope piece. So it is a esophageal obstruction clear case of, because barium is some partially passing, but it is being retained, it is overlapping this obstructive material. Now here you can easily appreciate that this is somewhat elliptical type of, whatever it may be, elliptical type of structure. So it may be some seed of some plant or some kernel, or it may be some cloth piece, or sometime rubber piece, or sometime leather piece. So in conditions of pica, the animal eat, and they are very easily diagnosed with help of the radiography in case by this barium meal. So usually we give barium meal by diluting 1:2 or 1:3 in large animals, and it is sufficient. If half liter to 1 liter you give, and just within 5 minutes you can take the esophageal radiograph. So this is a case of this esophageal dilatation. Beside this obstruction, when there is dilatation, you can also go for diagnostics with help of the, because many a time we see the soft tissue swelling, and owner tells that animal is not eating properly. Sometimes it is here the swelling is going on increasing. So you can just go for it, maybe either of traction type or pulsion type, whatever it is. So the barium meal will be, or the barium, you can say the solution will be here, it will be deposited. So it is clearly indicating that esophageal dilatation is there. Similarly, this is also a case of esophageal dilatation. You can appreciate the initial plain radiograph. Now after giving the barium meal, though it has passed, but it has been trapped. A quantity of barium has been trapped here. So it is outlining this, that esophagus is coming up to this extent. So it is giving the picture that this is a case of esophageal dilatation, and it can be treated initially conservatively, and later on, if it is not treated conservatively, you can go for surgery accordingly. Now in case of lungs, thoracic cavity, as I told you, thoracic cavity, this is with a little bit, for beginner radiologist, this is little bit hazy. So to clarify it, first I should say that when you are going for radiography of an adult animal, you should go for dividing this thorax in 4 portions, that is craniodorsal, craniodorsal, caudodorsal, cranioventral, and caudoventral. And we can then take the radiograph by just making the 4 positions. However, we usually perform this caudoventral and this caudodorsal mostly Sometimes if you suspect some cranial heart or cranial mediastinal affection, you can go for this also, or craniomedial. These three are more common, this is less common. So to just appreciate it, schematic diagram has been given here. Here you can see this is a radiograph of this cranial dorsal portion of this large animal, thus like equine or bovine. So this is a case of equine where this you can easily appreciate that this is caudal vena cava, this is pulmonary vein, this is pulmonary artery, and this big one is aorta. And these are the spines, these are the ribs. So it can be by having this is the, you can say carina, or what you can say this trachea, the last part of the trachea from where bronchi go. So you can appreciate. So by having this is the position of craniodorsal radiograph of the thorax of equine. Now, if you go for little bit, because in a single cassette of 14 inch, you cannot encompass whole of the thoracic cavity. So you can go for this cranio-caudodorsal position. So in caudodorsal position, we mostly see the lung lobes, the caudal lobes of the lung, and here this is the diaphragm. These are the pulmonary blood vessel, you can say, and this is, you can say, this you can appreciate little bit that this is the aorta. This is the aorta, and these are the pulmonary blood vessels, and this line is diaphragm. Similarly, when we go for the caudoventral portion, because here usually we go for the foreign body syndrome, little bit making it more caudal. So similarly, just like in foreign body syndrome, we put it cassette more upward because sternum is not taken here completely. In foreign body syndrome, we take the sternum completely. So we keep the cassette more lower and more caudal. However, in caudoventral view of the thorax, here you can appreciate this is the trachea, this is the aorta, this hole is the aorta, and this is the, you can say the shadow of elbow is coming also, and this is the diaphragm, and this area represents the reticular area, and this is the cranial mediastinal area. However, it is not easy to visualize. So this is cranial mediastinal area because this, after this, the heart will come. So this is the cranial part of the heart, and this is cranial mediastinal area. The heart will be here. As H is representing the heart, this is elbow, this diaphragm. In the cranio-ventral view, you can see that here you can go for having this cranial mediastinal area, and this is the trachea. We can have a thoracic part of the trachea can be visualized, and this is, you can say, you can appreciate here this humerus, and this is scapula little bit. So these are the four views. Now, if you see this radiograph, and you can easily appreciate that there is a level, there is a line after which nothing is visible, the radio opacity is clear. So this is a condition where there is pleural effusion, and you can say there is fluid in the pleural space. So in such cases, you will clear cut see a line which will demarcate the lung parenchyma. After that, it will not be visible, and so here it is a case of pleural effusion or fluid in the pleural cavity. Here you can see on our just previous basis that this is the aorta, and these are the pulmonary, this artery and this pulmonary vein. But this lower portion is hazy, and you can see a lot of here radio opacity is there. So this was a case of this respiratory pneumonia. And in case of respiratory pneumonia, mixed type of pattern like this alveolar pattern as well as interstitial pattern, both are visible. However, you can see some bronchi also, but this is hazy part is representing this mixed type of pattern of pneumonia. Similarly, you can see these structures in the lung parenchyma. In case of the large animal radiography, they are usually the cystic type of structures or some nodular growths. So this may be accompanied with the changes in the lung parenchyma, or they may not be accompanied. Here you can see there is complete radio opacity, means either there is fluid or lung has become consolidated. But here you can see there is no radio opacity, only this cyst is being developed. So it is a cyst-like structure or maybe some nodule-like structure, but most of the time it's circular growth. It usually on postmortem examination, it has been represented to be cyst. However, when the growths are irregular in shape, they are most commonly the nodules. Now this is a radiograph of the lung of a equine, you can say, and you cannot see anything much more than some part of the bronchi. So this is a case where there is lung edema, or you can see the alveoli as well as the pleural cavity, they are filled with the fluid. Only a part of bronchi is visible, so these animals have very little space for the exchange of air, oxygen, for saturating or for having SpO2 will be lesser than, you can say, 90 or 80, whatever it is, but they are in serious condition. You can see this level, this is indicating that there is pleural effusion up to a level, and alveoli are also not clear. So here it's a kind of lung edema where the parenchyma is also containing fluid as well as the pleural cavity is also containing fluid up to this level. So this is a serious case. Similarly, here also you can appreciate the different here alveolar type of this pneumonia, because here you can appreciate this aorta and this pulmonary artery means blood vessels, but part of this caudal ventral lobe of this caudal lobe, ventral part of this caudal lobe, they are not clear. The air space has been lost, so they are mostly the some alveolar pattern of the pneumonia. Now we'll shift to the radiographic part, of which we commonly, usually this is most common at our part, that our place, that reticulodiaphragmatic region of the animal, especially in large animal, and this is the most common case, foreign body syndrome. So this is a normal radiograph of reticulodiaphragmatic region of a large animal, buffalo or cattle. So here you can see we take the complete sternary part of the diaphragm, caudal thorax, as well as the cranial abdomen, a good part of the cranial abdomen. Means here reticulum is there, and this here. So if we see if it's a case of heifer, you can have a complete thoracic cavity in one X-ray. However, in large animal, as I was telling, you have to go for segmentation of the thoracic or abdominal cavity, and in abdominal cavity only the cranioventral part of the abdomen can be radiographed, because other part due to their larger thickness they cannot be radiographed. So this is a case of normal animal, healthy animal having this reticulodiaphragmatic area like this. This clear-cut demarcation between the air space and this fluid-containing viscera, that is rumen reticulum, this is making the line of the diaphragm, which is meeting here near the 6th or 7th sternary. This diaphragmatic line, it comes and meet at the level of around 6th sternary, between the 5th and 6th. So here you can easily see this is the 7th sternary, this is the 6th, this is 5th. So how the diaphragm comes, the heart is also completely visible and lung is also normal. But in case of diaphragmatic hernia, what we people usually ask, whenever there is any non-potential foreign body, not potential, always keep in mind that whenever there is any non-potential foreign body cranial to the line of diaphragm, means diaphragm should have come here. So if there is non-potential foreign body cranial to the line of diaphragm, that is a confirmed case of diaphragmatic hernia. Potential foreign body may penetrate and diaphragm may remain intact. However, when there is non-potential foreign body, that this is a ventral sac of the reticulum, means ventral part of the reticulum containing sand-like substances. So you can easily say that this is the 7th, this is 6th, and this is 5th. So it means it is proximal to the diaphragm, even though the diaphragm is not visible here. This is a confirmed case of diaphragmatic hernia. Similarly, here you can also see that some part of this diaphragm is visible only on the proximal extent. However, in the lower area, diaphragm is not visible. Otherwise, this line should have been the diaphragmatic line. And here you can easily see some non-potential foreign body along with this lady here clip, potential foreign body. They are cranial to the diaphragmatic line. So it's a case of, as well as you can appreciate the sac-like structure, the wall of the sac. So this is a case of diaphragmatic hernia. Similarly, here, similar cases, if you see that when the non-potential foreign bodies, they penetrate and they go up to the 4th or 5th or even 5th or 6th sternary, then this case of these all cases are of diaphragmatic hernia. Here you can see this is the diaphragm ending here. Then after that there is no diaphragm. This reticular sac is, this sac is coming here. This non-potential foreign body. So this is the diaphragm should have come like this, but there is no diaphragmatic line, and these all are non-potential foreign body inside the reticulum. Potential foreign body as well as non-potential foreign bodies are inside the thoracic cavity, and this is the line of the diaphragm line. It should have come like this, but it is going anterior to the diaphragm. Whenever you have confusion that if there is diaphragmatic, because most of the time we take the standing animal radiograph, and if there is confusion, then we go for recumbent radiograph in recumbent position. Make the animal recumbent in lateral recumbency and take the radiograph of the cranial abdomen as well as caudal thorax. So that will reveal. So here are some few pictures, because if these pictures have been taken from the pictures, so they are not too clear, but this should be the line. This is the line of diaphragm, and here you can see that there are some gas opacities along gas. Here you can see that there are some gas lines visible in this. So this is a case of diaphragmatic hernia along with diaphragmatic abscess. Here, but if you have confusion, still you are not clear and want to make sure, you can also go for contrast radiography. And if you will go for contrast radiography, you can get a picture like this. You can get a picture like this. This herniated sac of the reticulum will be clearly visible when you have confusion that this case of the case of DH or not. Now this is a case of traumatic pericarditis. You can see here this foreign body, potential foreign body, even the diaphragm is intact, but it is penetrating this pericardium, and it is also containing some gas portion. It means this is the case of traumatic pericarditis. This is diaphragmatic hernia with along with traumatic pericarditis, because here it was a case verified even after the postmortem also. So it was a case, you can see here the heart also and this diaphragm also without contrast, they have been mixed like anything. So this was along with the symptoms like brisket edema and this hydrothorax. So they all are making it to be a case of traumatic pericarditis. Sometimes without having pericarditis or peritonitis, sometimes foreign body they also penetrate the sternibry. So you can see here a structure, a needle-like structure which is penetrating the bone of the sternibry, just in the muscles of above the sternibry. Sometimes we see usual structures like these spoons. They are very common. Here in this, the spoon was visible, even the handle of the spoon was visible outside this animal ventral, from the ventral aspect, but this feeding side was on the inner aspect inside the reticulum. So the animal has to be operated and it has to be removed from the laparoscopy. Here also you can see the diaphragmatic hernia, and it is also containing a spoon. Sometimes needles are very much visible. Clearly this is a sewing needle. So all these, they are very much visible in case of diaphragmatic hernia. So beside this diaphragmatic hernia, many a time we get the cases of reticular abscess. And whenever that, here you can see the diaphragm is intact, but whenever you see a gas shadow, gas pocket like a structure along with containing some foreign body, then it's a case of, usually it's a case of 95% surety, it's a case of reticular abscess. Means if you are seeing a gas pocket in the reticular region or diaphragmatic region along with presence of foreign body in that, then these are usually a case of this reticular abscess. Here you can see this is the reticular region, this is a gas-like pocket, and some foreign bodies are contained inside this content, inside this gas pocket. Means it's a case of reticular abscess. Here also you can see that even though this gas pocket is here and this is a case of diaphragmatic hernia, this needle is visible here, but it cannot be sure that this is a case of diaphragmatic hernia or not, but there is an abscess inside the thoracic cavity. It may be in the reticulum, it may be on the diaphragm, but because this needle is localized inside this abscess and non-potential foreign body is visible inside this. So we are not sure whether this is due to the thoracic pathology or due to the DH. This case is because this metallic foreign body is here and this is having contained in some abscess, and this abscess may be in the reticular wall or may be due to the thoracic pathology or may be on the diaphragm. However, needle is visible here and gas pocket is, so it's a case of abscess in the thoracic cavity and non-potential foreign bodies are present here. So it may not be a case of even diaphragmatic hernia. Sometimes thoracic cavity or hello. Hello, am I audible?
Yes, you are audible, sir. Please go on.
Okay, sir, okay. So this is a case of
Okay.
abscess in the thoracic cavity due to this presence of foreign body. So it may not be a case of DH, but it's a case of abscess. Now here you can see that this is a case of diaphragmatic hernia along with potential and non-potential foreign. You can count the number of sternibri here. The transverse process of the sternibri, that's a 2 forward. Now here you can see just a case that this potential foreign body, it had penetrated inside this thoracic cavity, but no non-potential foreign bodies are inside the thoracic cavity. This is the 7th sternibri. So we usually suppose that such cases are not positive for the DH, but they are usually the cases having fluid in the thoracic cavity along with some penetrating foreign body. So it may be a case of traumatic pericarditis or pleuritis having fluid in the along with the potential foreign body in the thoracic cavity. However, on rheumatology, sometimes the distal end of this penetrating foreign body may be visible, may be traceable inside the reticulum, and we may retrieve from that state. So such cases are only confirmed after the laparorheumatology. Here you can also see a case that here the diaphragm is completely intact. However, this potential foreign body has is too forward in the thoracic cavity. So such cases, they may sometimes form the abscess around the elbow and the foreign body may come out sometimes may not, sometimes they may get fibrosed. However, here the lung parenchyma is completely this interstitial type of pattern of pneumonia, and even the heart shadow is not too clear. So there is too much chest pathology. However, the diaphragm is clear. Now, beside this reticular diaphragmatic region, equines and bovines, they also are mainly reported for the limb appendicular affections of the appendicular bones like limbs, mainly the cases of like arthritis. Here you can see the lack of joint space and the swelling, surrounding swelling. So it is clearly indicating there's a case of arthritis. Sometimes bony changes along with the arthritic changes are also evident. Here you can see the periosteal reaction, not bony changes are also here. So periosteal reaction or some bony dissolution is also here. So this may be a case of septic arthritis. It all has to be correlated clinically. Similarly, here in this case, you can see here the change in periosteal reaction over the proximal area of this metacarpal, and you can see this is the dorsopalmar view. Here you can see the fracture of the tibial talus. Similarly, we can go for the any kind of fracture. This is the most simplest X-ray examination whenever there is fracture. So to know the type of fracture and to what type of the therapy we can administer. So we go for, even though we are clinically it is appreciable that fracture is there, to have a clear picture of fracture, we should go for orthogonal examination of the fracture, and then we can only decide for the treatment. Either it's will be treated either by the which type of methods we should apply most suitably. Then here for the joint affections in cases of lameness, you can see here on the distal aspect of the femur, there are some maybe OCD like cases. This is a normal thing in case of, I have intentionally kept it here because when this is in growing animal, if you see the tibia, this usually absorbed normally. So at metaphyseal plate, there is normal cartilaginous structure which is visible like this in normal animal. However, in this case, it had prolonged too much. So that may be a green stick fracture at metaphyseal plate. But in case of young growing animals, cattle of 1 to 2 years, it may be visible normally. So here you can see that what is the importance of this taking radiograph by tube views means a dorsolateral, a dorsopalmar as well as the lateral or lateromedial. So you can appreciate that what is the displacement and what is the extent of the fracture, same fracture. Similarly, here also both views, lateral views as well as dorsopalmar view. Here you can see the fracture of the olecranon process of the ulna, because this is also very common in large animal that we get too many cases of olecranon process of the fracture of olecranon process of the ulna. In a smaller animal, means in animal having weight less than 200 kg or you can say 250 kg, we are able to easily appreciate the fracture of humerus also. But in heavy animal, this humerus fracture is not easily detectable because due to this thickness and the difficulty in placing the cassette. So in a smaller animal, this is a fracture of humerus, oblique fracture, it is very much visible. Now this is a fracture of tibia, you can easily appreciate. As I told you, this was in young animal. Here you can say that this is metaphyseal plate. This is not fracture, but this is metaphyseal plate. And this is the fracture. Similarly, here the femur fracture is visible, and here the fracture of the olecranon process is visible from this ulnar part. Now, in case of equines, many a time we see many cases like sourcing. So, some cases which involve the bone, we can go for radiography, and radiography is very much helpful in this. This is just typical representation, diagrammatic representation, that when there is a cases of sourcing like in young horses, you can easily appreciate the difference in the thickness of the two cortices because there is periosteal reaction and so much reaction, periosteal reaction, it looks too thickened. So this is a case of sourcing. Now we say in case of equines, especially in older equines or equines having lameness which has not been properly solved, this is just a diagrammatic representation that how equine foot is like. So this is collateral cartilage, this is digital cushion, this is third phalanx and second phalanx. So whenever this cartilage is usually not visible in the radiograph in normal horses. However, when it gets ossified, it looks like horns. You can say when you take a dorsopalmar view, it looks like this horn. So it should not be like this. If it is a cartilage, this third phalanx should have been like this. However, when this is like this, two horns that came up, it means these are the cases of the side bones. From clear-cut case of side bones means collateral cartilage has been ossified. So these are the cases of side bone. A very typical picture of the side bone. Then also in cases of the foot puncture, we are able to, with help of the radiograph, we are able to locate the extent of the puncture. If the puncture is not too deep, then this is very easily cured. However, when it is reaching the navicular area, then the prognosis becomes very grave. So you can diagnose and prognose the case on the basis of radiography also, that this foot puncture is penetrating around the navicular area and it is having a not good prognosis. This will take much more time even if it heals. Similarly, the cases of navicular diseases, in navicular diseases, if we go for having this dorsoventral view of the navicular bone or dorsopalmar view, you can see this radiolucent area in this navicular bone or distal sigmoid bone or increased channel of this vascular spaces. So they are the clear-cut indicators of the navicular bone. So these are the some few common large animal radiographs which are visible and which we can diagnose with help of the radiography, in which the radiography is very much helpful in diagnosis. Now, this is a case of pyramidal region, what we call buttress foot. Here you can see that extensor process over the third phalanx. It has been fractured and now healing is taking place. So clinically it looks like this. So if you put it on a lateral radiograph, lateromedial radiograph, then you can see that there was a fracture, and you can easily appreciate. You can ask the animal for the proper shoe, honor for the proper shoe, as well as you can recommend the treatment. So this large animal radiography helps you a lot in large animal lameness and treatment, diagnosis as well as its treatment. The another common condition in older horses, they are the ring bones, and the ring bones, as you know, this is a normal phalanges. They are the extra phalangeal growths. So these are the normal phalanges. This is first phalanx, second phalanx, and third phalanx. This is the distal smart bone, what we call it navicular bone. So here you can see that this is a ring bone. There is a periosteal reaction or exostosis on both the sides. However, the articular region is clear, so we can call it high ring bone. However, it is progressing downward. So ring bone we classify that high ring bone means which is involving the this pastern joint, where this first distal aspect of the first and proximal aspect of the second phalanx is showing some periosteal reaction. However, in low ring bone, we know that the third phalanx and the proximal aspect of the third phalanx and distal aspect of the second phalanx, they are showing the periosteal reaction. However, this is not involving the joint, so they are non-articular. So they are the high ring bone and they are the low ring bone. However, ring bones are also classified as articular or non-articular. Here you can see that the joint space has been lost along with the exostosis on this distal aspect of the first and proximal aspect of the second phalanx. So we can call it articular ring bone. Like if we make a picture, then it would have been look like this. So on radiography, you can appreciate that ring bone is high ring bone, low ring bone, articular ring bone, non-articular ring bone. However, here you can see that this is periarticular ring bone. Here it is, you can see the clear, the joint space is completely clear. However, it is completely obliterated in this. So you can easily appreciate that where the disease is located, and accordingly you can advise the treatment. So by this way, the large annual radiography is very much helpful in diagnosis, and this is one of the still being main use tool at every referral, mean I to say institutional as well as polyclinics and major hospitals for the diagnosis and treatment of large animals. Thank you. Thank you for patiently.
Thank you, Dr. R.N. Chaudhary. So nice presentation. I request chairman of the session.
Thank you, Chaudhary sir, for a very informative presentation. Now, topic is open for discussion. If any questions and queries, they are welcome.
Good morning, sir.
Good morning, please, sir.
Sir, I'm Dr. Shardul Salvi, PG second year student from Junagadh, surgery department. Sir, how to differentiate between osteosarcoma and ring bone? Because I guess radiographic appearance of both are similar. So how to differentiate between them?
No. Radiographic appearance of osteosarcoma is completely different. Yes, osteosarcoma, what we usually call it is that it is a case of sunburst appearance. Means here in ring bone, you can only see the periosteal reaction. In ring bone on the phalanges, as I showed you, that you can only see the reactions over the periosteum. There will be no changes inside the bone. Means only both sides on the cranial aspect as well as on the caudal aspect, you can see the periosteal reaction. However, in osteosarcoma, it will be just means complete bone will be involved, and it will be just like if there is a burst. Means from mid side, all the bones will be involved and they will be bursting outside. As well as there will be more radiolucency inside, means in the center of this osteosarcoma, and it will grow all along the means all circumferentially, you can say, or centrifugally it will grow. However, in this case, only the periosteal portion will be involved in case of ring bone. Means cranial aspect or caudal aspect, There will be no involvement of this all along the bone. Complete bone will not be involved. Only this is exostosis in ring bone.
Okay, okay, sir. Thank you so much, sir.
Any questions from the delegates? Queries? So there is no query. So
If there is no queries, then I conclude this session, this lecture here. Thank you very much, sir. Thank you, Chaudhary sir, for a nice presentation. Thanks a lot.
Thank you, sir. Thank you.
अच्छा जाएगा
चलो जाते हैं।
बहुत बढ़िया यही कलर Good morning, doctor.
Good morning, sir. Good morning. How are you all?
I'm fine. Welcome to your son of soil here.
Yes, sir. Thank you.
Virtually, you can say. Thank you for your accepting our invitation. I hand over the session to chairman of this particular morning session, Dr. M.D. Odedra.
Good morning, sir.
Good morning, Dr. Javia. I welcome you. Now, I give the introduction of this, our next eminent speaker, Dr. Chirag Javia, who was born on 15th February 1988 in the Ugri village of the Sutrapara Taluka. He started graduation in veterinary field at Anand Veterinary College from 2005. In 2010, he started post-graduation in veterinary surgery and radiology under the guidance of Dr. P.H. Tank, sir. He did his research work on tibial fracture management with external fixation, and he got exceptionally good success in his research work, which allowed immediate post-operative weight bearing on affected leg. After completion of his MBSc study, he moved to Ahmedabad and started his pet practice under the name of Pets and Paws Veterinary Hospital at Bhopal area of Ahmedabad in June 2012. At Pets and Paws Veterinary Hospital, all diagnostics and treatment facilities were available, like in-house laboratory, in-house X-ray and sonography, etc. He also started equine sonography for early pregnancy diagnosis as well as infertility management. In 2017, he started his second branch of Pets and Paws Veterinary Hospital in Naroda area of the Ahmedabad. He guided and motivated so many veterinarians to start their own private practice in pet field. In 2019, he became the founder president of Pet Practitioners Association of Gujarat. So now I welcome and invite Dr. Chirag Javia to deliver his talk or lecture on the importance of the advanced diagnostic techniques in pet industry.
Thank you, sir.
Screen share.
Screen sharing karo, Dr. Javia.
Yes, sir.
मैं इसलिए तो बोला आप इधर आ जाओ मैं थोड़ा ये बात
आ गया, सर?
हाँ yes yes please.
So good morning to all my dear colleagues, professors and all participants. First, I would like to thank to Junagadh Veterinary College to invite me to take a lecture on importance of advanced diagnostic techniques in the pet industry. As we all know, the pet industry is the highest growing industry in India as well as in the world. And day by day, there is a daily increase in the pet lovers as well as the pet parents, and day by day, all peoples from the each class, like in the middle class, like in the higher middle class, or in the higher class, they are adopting a pet for their companionship. And as we all know, there is a emotional attachment of all pet parents toward their pet, and due to their emotional attachments, and even in the recent scenario, there is increasing in the awareness regarding the treatment facilities, regarding the diagnostic facilities and all that. So daily increasing in the awareness, as well as there is increase, we recently noticed in last few years that the increase in the paying capacity is also increased. So due to the increase in the paying capacity, the demand will automatically generate for the advanced diagnostic techniques for their pets. So I would like to discuss regarding the advancement in the diagnostic techniques. A number of imaging procedures have been developed to help the diagnose the disease and in the human medicine, and many of these diagnostic techniques have been adapted to use in the animals and use in the pets also. Some of the latest innovation in the imaging and treatment technologies had led to less invasive and more accurate and even faster diagnosis of disease, which improve outcome of our pets. Veterinarians usually add these new tools to their treatment arsenal to identify the best treatment option for their patient, with the ultimate objective of avoiding invasive procedures such as surgery when possible. And over the last decade, the quality of the diagnostic imaging equipments and the habits of using it for diagnosis in the veterinary practice has greatly improved. Now we can think about the number of the diagnostic techniques which usually available in the veterinary field. Most commonly, we use digital radiograph. In the earlier years, we used to take film in the dark room, and now there is availability of the digital x-ray, so we can modify the view, we can modify the amperes and the kvp and all that. So with the compromise use of the exposure and all that, we can create a very good quality of the radiograph with the advancement of the technology. Usually ultrasonography is a very common, and CT scan and MRI is also used in the veterinary practice, particularly for the small animal only. The present review briefly gives an update of the development and the present status of imaging techniques in the veterinary medical diagnosis. Now, there are so many other diagnostic techniques like laboratory diagnostic techniques, endoscopy, laparoscopy, and otoscopy is also available. We will discuss one by one. Now we come to the digital radiography. So digital radiography is to create an image of the body with the use of the X-ray beam, and it will give you the black, white, and gray images. And X-ray is being used from the so many years to create an image of the affected part. And radiography is the most common imaging procedure which is being used in the veterinary practice, and it's more convenient for the small animal practice, but it's little bit difficult in the large animal practice. But we can use a portable x-ray machine to take an x-rays of the leg and all that of the large animal. Although the procedure is painless, in some cases, and as per the my experience of the last 10 years of practice, sedation is mostly required to take a good quality of x-ray, because x-ray needs a proper immobilization of the patient to take a proper view. And if the patient is not being seded, then the X-ray quality will be differ. And we can also reduce the anxiety and stress to the patient, because we are taking X-ray, so there is so many handling and all that. So the sedation is always required to take a proper view and to take a proper diagnosis of the patient. And second one, as per the thumb rule, we always used to take a two view of the affected area, so we can take a proper diagnosis of the desired organ. With the use of the X-ray, it's mostly work for the bones, foreign objects, and the large body's cavity. But with the use of the shadow and all that, we can apply it for some soft tissues like liver, spleen, kidney, intestinal loops, stomach, and all that. Although the radiograph may not give enough information to determine the exact cause of your pet problem, but they can help you or your veterinarian to determine which other tests may be needed to make a proper diagnosis. Body soft tissue do not absorb X-ray well, but it can be difficult to see using it the technology alone. But there are so many other technologies are also available, like sonography or CT scan to detect soft tissue abnormality in the pet. Specialized X-ray techniques are also available, like contrast radiograph, that are used to help provide more detailed images of body organ. And in this contrast radiography, we used to give a dye from the oral route to take a digestive tract radiograph, and intravenously dye is also available to analyze like kidney and heart and all that. And after giving a dye, we need to take a series of the X-rays to detect an abnormality of the desired organ. There are so many conditions which we can diagnose with the X-ray. Most commonly is the mega esophagus, which is being very common in dogs. Uh, foreign bodies foreign body cases are also coming, and with the help of the X-ray, we can easily diagnose the case of the foreign bodies in the stomach or in the intestinal loops also. I would like to discuss one case of the 3-month-old German Shepherd puppy. They came to us for taking a second opinion, and the puppy's history is having a chronic diarrhea and vomition, and having a continuously high WBC count. And even with the traditional treatment of the higher antibiotics and fluid therapy and all that, but puppy is not being recovered. And then we thought that we need to analyze the intestinal loops and stomach and all that. So we take an X-ray, and we found that there are multiple foreign bodies, and with the history of engulfing the stone and all that. So the importance of the X-ray, we can say that when you are facing a difficulty with the traditional treatment, you should always go for the X-ray. And with the help of the X-ray, we can detect like foreign bodies and all that. One again a case of the tumor at the mandibular joint, and they came to us to detect an tumor. So we took an X-ray, and surprisingly we all found that there is a small needle which engulfed with the food, and it was there, and it will create inflammation, and some were looking like a tumor. So with the help of the surgery, we removed the needle successfully. So with the use of the X-ray, we can have a diagnosis like this. uh, Abdominal X-ray is very useful to detect gastric dilatation and volvulus. So we can detect the size of the stomach. We can check the placement of the stomach. So if there is any rotation in the stomach, or if there is any rotation in the spleen, so we can easily detect with the X-ray. With the use of the X-ray, we can say, or we can analyze the liver, So size and shape of the liver, size and shape of the spleen also we can detect. And with the use of the thoracic radiograph and the abdominal radiograph, we can detect the diaphragmatic hernia also, and it's rarely common in the pet, but it's may come in the practice. With the use of the chest x-ray, we used to check the size of the heart, and with the use of the vertebral heart score, we can detect any heart abnormality. So chest x-ray is also helpful to detect the cardiac system. With the use of the chest x-ray, we can analyze the lung, like if there is any metastasis in the lung, so we can detect if there is any pneumonia condition or congestion. So it's very useful to detect x-ray abnormalities in the chest. With the use of X-ray, we can also detect kidney abnormalities, like the shape of the kidney. We can also see in the X-ray. Intestinal loop, if there is any inflammation in the intestine, or if there is any abnormality in the intestine, so we can easily diagnose with the X-ray. Urinary bladder stone is very common in some breeds of the dogs, like Labrador, Pug, Dalmatian, Lhasa Apso. So with the use of the X-ray, we can easily detect bladder stone, or urethral obstruction is also very common. With the help of the X-ray, we can easily diagnose the urethral stone. Even ureteral obstruction are also frequently coming, and due to the stucking of the stone in the ureter, and it will directly increase the level of the creatinine. So with the use of the x-ray, we can detect the level of the and the position of the stone in the ureter. Tumor we can easily detect with the x-ray, and the tumor connection with the any organ. So we need to take an x-ray from the different angle, so we can easily detect the tumor size and the connection of the tumor with any organ. Bony diseases like fractures, degenerative joint disease, and the hip dysplasia is very common in the dogs, because the dogs are keeping in the in house with the slippery floors, and with the predisposing factors, the hip dysplasia is very common nowadays in the large breed dogs. And with the use of the x-ray, with the use of the different angle of the x-ray, we can easily detect the staging of the hip dysplasia. And cruciate ligament injury is a very common, and we can detect the cruciate ligament injury with the use of the x-ray. There are so many cases of the accidental injury, and accidental injury is very common in the street dog as well as in the pet dogs. And with the use of the x-ray, we can evaluate the spinal and vertebral column status. So the x-ray is very important for taking a proper diagnosis, and it's a primary tool for detecting abnormal diseases or abnormality in the pet. Now we can come over the sonography. It's very common, and it's easily available tool for the veterinarian to go for the sonography. Ultrasonography is the second most commonly used imaging procedure in the veterinary practice. It uses ultrasonic sound waves to create images of body structure based on the pattern of the echoes reflected from the tissues and organs. Ultrasound is much better than X-ray when you are talking about the soft tissue within the body. And the veterinarian or technician usually perform an ultrasound scan by pressing a small probe against the animal's body, most frequently the abdominal wall in the pets. and the sound waves are directed to various parts of the abdomen by moving the probe, and echoes occur as the sound beam changes velocity while passing through tissues of the varying density. The echoes are converted into electrical impulses that are then converted into the images that represent the appearance of the tissue. Usually, we perform the sonography to detect like vital organs like the liver, kidney, spleen, gallbladder, urinary bladder, intestinal loop, stomach, ureter, and some gland like the adrenal gland, prostate glands, and we can easily detect the if there is any free fluid in the abdomen that we usually called as SITs condition, and some hernial content we also can be detect with the help of the sonography. So the content of the hernia or the size of the hernial ring we can easily evaluate with the help of the sonography. Usually for the liver, we can detect the size of the liver, if there is any degenerative changes or if there is any change in the portosystemic shunt. So we can easily evaluate the liver problem with the sonography. Kidney diseases is very common in the pet industry, and with the use of the sonography, we can easily detect any abnormality in the kidneys like stone, degeneration in the kidney. There is a particularly two type of the part in the kidney, cortex and the medulla. And when you are scanning a normal kidney, so you easily differentiate that there is a corticomedullary differentiation in the kidney. But when there is an abnormality in the kidney, you can easily diagnose with the help of the cortex and the medulla. So when there is a degenerative changes, the differentiation between the cortex and medulla become merged. And when there is a chronic kidney disease, so when there is a chronic kidney disease, the calcification is started in the corticular part of the kidney, and with the help of the sonography you can easily detect the calcification in the outer part, that is the cortex of the kidney, and you can predict the outcome of the treatment, or you can predict the prognosis also with the use of the sonography, that there is a reversible changes or irreversible changes with being in the kidney. Spleen also we can check the size, if there is any tumor, if there is any abnormality, there is any degenerative changes. So with the help of the sonography we can evaluate the spleen, kidney and the liver. Regarding the gallbladder, there is so many conditions like the vesicles in the bladder, or there is a gallstone also. So we can easily detect with the sonography in the gallbladder. As per we discussed in the X-ray session, that there is so many condition like stone and the tumors in the urinary bladder, and we, with the help of the X-ray we can also detect them. But there are so many stone, that is a radiolucent stone, that can be detected with the sonography. So it's very useful to detect the urinary system. Intestinal loops, we can also detect some intestinal obstruction, or telescoping of the intestinal loops. So with the help of the sonography we can detect the intestinal abnormality. Stomach abnormality we can also detect. Ureter we can also see with the sonography. So if there is any obstruction in the ureter, if there is any narrowing of the ureter, so we can detect it easily with the sonography. Most common problem is the benign prostatic hyperplasia, and we can easily detect it with the sonography, and we can check if there is any benign hyperplasia, or if there is any fluid collection in the prostate, or that, or SITs we already discussed, hernia we already discussed. We used to do sonography very common for pregnancy diagnosis in horses as well as in dog and cat. First, I would like to discuss regarding dog and cat, that we can easily detect the pregnancy, viable pregnancy at the age of the 20 or 25 days. So we can easily say there is a formation of the fetuses uh, in the uterus, and if there is any live or dead fetus, so we can easily detect with the help of the sonography. So pet owners can easily have a proper diagnosis कि our female pet is carrying how many pups in the uterus and all that. With the help of the sonography, we can even evaluate the development of the pups. We can also detect any abnormality in the fetus. We can check the heartbeats when there is a 55 days or 60 days of pregnancy. So we used to do to check the heartbeats of the pups in the uterus. So we can easily say there is any abnormality or not. Even position of the fetuses we can also detect with the sonography. So we can take a conclusion like if there is any need of the C-section or if there is any need of the assisted delivery. So with the help of the sonography, the gynecological examination is very easy. And now we can discuss regarding the horses, that the sonography is very useful tools to detect the early pregnancy. And with the experience of the 5 year, we can detect the early pregnancy in the mare at the day 21 days. So 21 days, there is a small round with the anechoic circle and with the two pole with the hyperechoic structure. So you can easily detect 21 days pregnancy in the mare. And with this help of the early diagnosis of the pregnancy, we can save our time. We can save horse owners time to entering into the infertility treatment. And regarding the infertility is now the biggest common issue in human also, and even in the animals also. And with the help of the sonography, we used to detect any uterine abnormality. We used to detect any ovarian abnormality like ovarian cancer or cystic ovary or endometritis, pyometra. So there are so many conditions that we can be diagnosed with the help of the sonography. And those mare who are having no sign of the heat or no sign of the estrous cycle, so we used to evaluate her ovary with the sonoscan. And we can evaluate the size of the follicle. So and we can predict the date of the ovulation. When there is a maturation of the follicle become a 45 to 55 mm. And at that time of the 45 to 55 mm of the follicle, you can cover up the mare, and there is a greater chances of the conception. And pyometra is once again very common in dog also. And with the help of the sonography, we can detect the pyometra, and we can early detection of the pyometra is possible with the regular evaluation with the sonography. uh, Even heart evaluation with the help of the sonography is also in the use, and is commonly called as echocardiography. With the use of the echocardiography, you can evaluate the functionality of the all four valves of the heart. And according to the diagnosis, and we can modify the treatment. And we can easily diagnose if there is any abnormality in the valvular structure of the heart. When we are talking regarding the advancement in the diagnostic techniques, now we are talking about the heart sonography. So we can take a point regarding the echocardiography, that is the electrical conductivity of the heart. And with the use of the ECG, we can easily diagnose any electrical conductivity problem in the heart, and we can treat accordingly. There are so many conditions that we can diagnose with the ECG. And at our hospital, we are commonly using ECG for those who are having chronic coughing, or those who are having exercise intolerance, those who are having senior age criteria. So we used to create a normal ECG, and we used to detect any abnormal, and we treat them accordingly with the treatment, and we are getting a very good result with the use of the ECG, and we can easily prevent major abnormalities when you are treating in the early stage. So after the X-ray and the sonography, echocardiography and ECG, now it's a least common technique that is being used in the pet industry. That is a CT scan, and the CT scan is now famous due to the corona. So with the use of the CT scan, we can evaluate in a three-dimensional way. If you want to detect any organ, if you want to analyze any organ in the three-dimensional way, we need to go for the CT scan. Computed tomography is a CT, is a computer enhanced X-ray procedure. So it's a kind of the X-ray, but with the help of the too many X-rays from the different angle, we create CT images. And so CT is a computer enhanced X-ray procedure used to detect abnormalities in a various body organs. And because of this expensiveness or the not availability, so it's very least useful in the veterinary field, and this procedure is not used for pet as often as other imaging type. However, it may be available in some locations like in the metro cities. So such hospital associated with the veterinary school or large specialty practice may occasionally be recommended. In this procedure, the animal is placed on the motorized beds inside the CT scanner. We take a series of the X-rays from different angle. When one series or scan is completed, the bed is moved forward and another scan is taken. And the CT scan differ from ordinary X-ray because they show different level of the tissue density and produce more detailed images that we discussed earlier, that it will take a multiple X-ray from the different angle, and it will create the three-dimensional view of the any desired organ. So from the scan, a computer creates a cross-sectional images of the body part under investigation and display the images on a monitor. CT has been extremely significant development which has a unique cross-sectional imaging ability which can be useful for the diagnosis of the tumor, the diagnosis of the malformation, inflammation, degenerative and the vascular disease or some traumas. So when we are discussing regarding the tumor, as per our experience, that some of the tumors we cannot be diagnosed with the X-ray or with the sonography, because some tumors in the abdomen or some tumors in the brain or in some other location, we cannot be easily, or it cannot be 100% diagnosed with the use of the X-ray and sonography. Then we usually recommend for the CT scan. We recently do 3-4 CT scan of some our patient with the liver tumors or some splenic tumor and some brain tumor. And so with the help of the CT, we can easily diagnose the size of the tumor. Also, we can easily say there is an attachment of this particular tumor with particular organ. So we can treat them accordingly, or we can operate them accordingly. And with the help of this CT, it's very helpful in cases of the acute trauma involving complex areas of the anatomy such as skull, spine and the pelvis. And there are some other techniques are also available like contrast radiography. So in the computed tomography, the dye is also available. So we can inject it intravenously, and we can take a series of the X-ray or series of the CT scan, and we can easily diagnose the size of the tumor, exact location of the tumor and the connection of the tumor with the neighboring structures. So this can be used by the veterinarian to detect the structural changes that can be deep within the body, including tumors, abscess, and changes in the blood vessels and some fractures also. And after the CT scan, we can go for the MRI. As the CT scan, there is one limitation because we need to give always anesthesia to go for when we are going for the CT scan. So it's a little bit difficult, and it's a little expensive also, and it's not easily available. So there are so many limitation or so many negative points that we cannot use a CT scan very commonly. Otherwise, as per our all recent experience with the use of the CT scan, we can easily evaluate the status of the lungs. It being used in the COVID treatment. So CT scan is very useful, but it's not easily available in the veterinary field. Just like the CT, the MRI, magnetic resonance imaging, is also part of the advanced diagnostic techniques. So MRI is another form of imaging in use of today. It is an alternative to the computer tomography, and it's totally a SEP. With this procedure, very powerful magnetic field generate, and it will create an anatomic image of the desired organ scanning, and no x-ray are involved in, and it is very extremely safe. However, because of the expense and size of the equipment, the need for specialty trained technician, this procedure is not often or is not common use for the pets, and not for the large animal also. And due to the size constraint, it is not practical for use in horses and other large animals. But with the recent news and all that, there are in the foreign countries, there are some equipments are available that are being used of the MRI in the horse's spine for the racing horses. So for this procedure, the animal is placed in the tubular electromagnetic chamber, just like the CT scan, and pulse with the radio waves, causing a tissue in the body to emit the radio frequency wave that can be detected. And many repetition of these pulses and subsequent emission are required. The emitted waves are then converted into the images that are displayed on the computer screen, and the images can also be saved for the additional study, and it can be analyzed for the abnormality. Subsequential examination of slices through the body is done in the same way as for computed tomography, and because of the procedure is rather lengthy and the animal must not move throughout the procedure, the general anesthesia is must for such type of the cases. And MRI is highly sensitive and non-invasive technique, providing accurate and detailed anatomic images with good contrast and the spatial resolution, which is used to investigate the anatomical and the physiological function of the body tissue. And due to its superior soft tissue contrast, MRI remains the primary method of imaging for diagnosis of the soft tissue damage like meniscal, ligament, tendon, and when there is a very precious pad and with the history of the accidental injury, we used to recommend the MRI for evaluation of the spinal cord, so we can easily detect and we can treat them accordingly. Uh, it's very common in the cats when cat used to have a fallen down from the heights and there is possibilities of the spinal injury. We used to do the MRI of the cats or and dogs, those who are having accidental injury, and we can detect the abnormality in the spinal cord. We can detect the abnormality in some tendons or in some ligaments, and we can treat them accordingly. It is very useful in answering many questions related to the musculoskeletal disease in animals, such as understanding the pathogenesis of the navicular diseases, traumatic arthritis, and the osteochondrosis in equine also, and the wobbler syndrome in the dogs. Uh, it's not over now. I have so many topics that can be discussed. Uh, So these are about the X-ray, sonography, CT scan, and MRI. Because of some problems, I forgot to add the slides. That there are some advanced techniques which is easily available in the field of the veterinary, like endoscopy, laparoscopy, and otoscopy. Regarding the endoscopy, it can be used for the evaluation of the respiratory tract, or with the use of the direct invasion, we can detect any abnormality in the esophagus, we can detect any abnormality in the stomach or in the small intestine also. With the use of the passing from the endoscopic probe in the rectum, we can easily detect any colonic abnormality and all that. With the use of the laparoscopy, we can do some surgeries also, and we can easily detect direct view of the abnormality in the abdomen. So laparoscopy is also a very good tool, and endoscopy is also very good tool. Otoscopy, with the help of the otoscopy, there are so many breeds in the dog. Like German Shepherd is a very common for having a ear problem. So with the help of the otoscopy, we can easily detect any major ear issue, or if there is any severe problem in the otitis interna. So we can easily detect a problem and we can treat accordingly with the help of the otoscopy. Regarding the laboratory, is a very useful tool which is being used in the veterinary field, that with the help of the laboratory we can easily see the level of the infection, the level of the hemoglobin. With the use of the biochemistry, we can analyze the functionality of the liver, kidney, and some other problems also. Uh, just like in the corona rapid test, there are so many diseases like parvo, distemper, babesia, ehrlichia, anaplasma, Lyme disease, heartworm, rabies. So there are a rapid ELISA kits is available that can be used to detect on a very short time. So it's also advancement in the diagnostic technique that can be used with the laboratory finding. There are so many cases of the it's a very common called like tick fever, and when you are using a common treatment that not responding to the traditional treatment, then we need to diagnose it properly. When we do the smear and there is no any detection of any hemoprotozoal condition in the dogs or in the horses, we used to do the PCR test to detect a proper diagnosis that there is a babesia, or that there is a ehrlichia, or that there is a anaplasma, and we can treat them accordingly. So the laboratory diagnosis is also very useful. Today we discuss regarding advancement in the diagnostic techniques in the pet industry. So we discuss regarding the digital radiograph, ultrasonography, CT scan, MRI, laboratory diagnosis, endoscopy, laparoscopy, and the otoscopy. So I hope you all get the proper understanding, and I would like to end my lecture over here. Thank you so much, sir.
Dr. Chirag,
Yes, sir.
so nicely presents and as a practical,
Yes, sir.
was a practical man in the clinic. Do you have any difficulty while doing the MRI?
Yes, sir. There are so many problems. The first one is easily availability, because there is no any specific veterinary center those who are providing a CT scan and the MRI facility. So we need to request the human radiologists to allow us to go for the MRI and CT scan. So those the human radiologists who are attached with the pet, or those who love the pet, they allow us to go for the MRI and CT scan, but because of the so many problems like in the socialization and all that, so we need to do mostly in the night hours only when there is no availability of the human patient.
Okay.
So they allow us to do like this.
Previously, around 2009, 2010, we are used to do in Tata Cancer Hospital in Mumbai.
Okay.
But the limitation is there because it requires minimum 35 minutes.
Yes, sir. Yes,
Whole
sir.
procedure,
Yes.
and it was so magnetic field, and you are supposed to maintain anesthesia 35 minutes, 45 minutes. It is very
Yes, sir.
difficult.
So
If
regular
suppose there
maintenance
is
of the anesthesia is
live
also required.
movement is there, the whole picturization is gets blurred.
Yes.
So that is a main limitation. Timing and the anesthesia we
Yes.
previously faced. So thank you for your feedback. Any PG?
Good morning, sir.
Good morning.
Sir, I'm Dr. Shardul Sarvi, PG second year student from surgery department. Sir, as you are using ECG in your clinics, I have a doubt about atrial fibrillation and atrial flutter. So how to differentiate between these two?
Atrial.
Fibrillation and atrial flutter.
Okay. Atrial fibrillation and atrial flutter.
Yes, sir.
Okay. So if there is any atrial fibrillation, that is it is very easily diagnosed with the ECG. But if there is any atrial flutter, then we need to go for the echocardiography.
Okay.
So with the help of the echocardiography, you can easily see the any abnormality in the valve, and with the help of the ECG, you can easily diagnose the atrial fibrillation. So there is changes in the
QRS complex.
echoes, so we can easily diagnose.
Okay. Thank you, sir.
And again, ECG is also a complicated procedure. Like when you are giving anesthesia, so the ECG is not proper. So under the anesthesia, it is not advisable to do the ECG. And with the without help of the anesthesia, the ECG is not easily in all pads. So those who are calm and those who are easily handable, the ECG can be used. But in all the pads, it is not possible to do the perform a proper ECG.
Okay. Thank you so much, sir.
Okay, welcome.
Chairman.
Any question from the virtual audience, online members? So there are no more questions, Dr. Javia. It was a very informative presentation, nicely presented by you.
Thank you, sir.
Purely practical views you have explained, and I explain my thanks to you for presenting such a nice lecture. Thank you very much.
Thank you so much. Thank you.
Thank you. Thank you.
Sir.
Welcome.
Very good afternoon to all, and welcome to this plenary session of this 5-day vocational training on advanced diagnostic techniques in livestock and pets. So we have the dignitaries to grace this function. We have Honorable Vice Chancellor JU Dr. V.P. Chotia sir with us. We have Principal and Dean College of Veterinary Science and Animal Science, Organizing Secretary Dr. S.H. Talekar sir, Co-Organizing Secretary Dr. R.H. Bhatt sir and Dr. A.K. Sharma sir, all other committee members, all faculty members and participant students. So to begin this plenary session, I request Organizing Secretary of this training, Dr. S.H. Talekar sir, for welcome address.
Thank you. A very good morning, good afternoon to all. First and foremost, my heartfelt welcome to our Honorable Vice Chancellor, Dr. V.P. Chotia sir, and President of today's plenary session, Junagadh Agriculture University, Junagadh. It gives my immense pleasure to welcome respected Dr. P.H. Khan sir, Principal and Dean, College of Veterinary Science and Animal Husbandry, Junagadh. I also welcome to all university officers and all the principal deans of various constituent of College of JAU and other state agriculture universities of Gujarat and dignitaries from the country and those who are attending this plenary session in online mode. I also welcome to co-organizing secretaries, joint secretary, treasurer and the central organizing team of this vocational training program. I also wish the conveners, chairman, co-chairman, rapporteurs of the various committee, all members of this vocational training program. It is my pleasure to welcome all the delegates, faculty members, students, and the eminent speaker, those who are virtually joining us. Welcome to the press and the media persons also. Thank you.
Thank you, Dr. Talekar sir, for welcoming with words. Now, to welcome our dignitaries with flowers, I first request respected Principal and Dean Dr. P.H. Khan sir to welcome our Honorable Vice Chancellor sir, Dr. V.P. Chotia sir, with bouquet of flowers. I request Organizing Secretary Dr. S.H. Talekar sir to welcome our Principal and Dean Dr. P.H. Khan sir with flowers. I request Co-Organizing Secretary Dr. R.H. Bhatt sir to welcome Organizing Secretary Dr. S.H. Talekar sir. Thank you all. Now, moving forward, we have the presentation of reports of various technical sessions from day 1 to day 5. So, to present the report of technical session for day 1, I request Dr. J.P. Joseph, Assistant Professor TVCC, to present the technical session report of day 1.
Respected all dignitaries on the dais and off the dais, all virtual participants, good afternoon to all. Day 1 of the online training started with inaugural ceremony on 4th January 2021 at 9 a.m. in the morning. The first technical session was chaired by Dr. A.R. Alawat and co-chaired by Dr. A.R. Bedani. It has 3 presentations by eminent speakers. First subject for discussion was Emerging Subjective Diagnostic Techniques in Animal, handled by Camel Man of India, Dr. P.K. Gallat, retired professor and head, Rajwas, Bikaner. Gallat sir demonstrated newer facilities at Rajwas for diagnosis and treatment of animals. He detailed on camel production throughout the world, especially in India, and history of starting mandibular fracture immobilization in Uganda. In his lecture, he stressed on the point adapt or die. Veterinarians should adopt newer technologies and should be familiarized with newer drugs to thrive in the field. He also gave idea on virtual and augmented reality to artificial intelligence, which helps for better understanding of lesions or diseases for proper diagnosis. Sir also pointed out keyhole surgery, robotic surgery, etc. in veterinary field. He explained different newer techniques in veterinary practices such as CT scan, MRI scan, PET scan, fluoroscopy, 3D or 4D ultrasound, scintigraphy, laparoscopy, etc. during the session. Laser surgery, cryosurgery, physiotherapy, lithotripsy, dental implants, etc. were also subjects for discussion. Not only this, he also gave insight how to get newer information on veterinary practice or techniques, and he wished our training will be good beginning for updating knowledge of veterinarians. Next speaker was our principal and dean, Dr. P.H. Tang. Tang sir talked on importance of continuous education in veterinary surgery and radiology. He stressed on the point that attitude of veterinarian should be changed to adopt newer technologies so that traditional veterinarians can be changed to updated veterinarians. Many veterinary fields are changing, so the surgeon can never be outdated. Learn, practice, make it perfect will help for mastering a newer technique. Sir also acquainted different facilities in Junagadh Veterinary College like CR, CM, endoscopy, small animal anesthesia machine, thermography unit, etc. He also introduced a newer technique developed recently at Junagadh Veterinary College to overcome perfusion collapse in bulls and summarized his talk by telling AO Ash's slogan, movement is life, life is movement. In the third presentation of session, Dr. D.P. Patil, DR and Dean PG, Kamden University, Gandhinagar, elaborated on veterinary ophthalmology and overview. Sir explained different ocular reflexes, different diagnostic tests such as tonometry, ophthalmoscopy, gonioscopy, ultrasonography, fundoscopy, electroretinography, etc. for diagnosis of eye diseases with detailed description. Ocular pathologies including exophthalmos, ptosis, blepharitis, sterei, glaucoma, uveitis, etc. were explained, including its medical and surgical management techniques. Very scientifically and systematically, Patil sir explained identification of corneal ulcer and corneal melanosis in pugs. Also, he said that progressive retinal atrophy can be controlled by eliminating carrier dogs by gene testing. Afternoon session was a demonstration by Dr. S.S. Talekar on importance of computed tomography for diagnostic purpose in small animal practice. Talekar sir explained why is CT scanning gaining importance in veterinary practice, what are the preparations before performing, and what are the precautions while performing. He described different clinical cases in which CT scan was performed to identify the underlying disorders. He also detailed on different types of CT scanning. I thank the organizing secretary for allowing me to act as rapporteur of this session. Thank you all.
Thank you, Dr. Joyce. Now, for the presentation of report of technical session day 2, I request Dr. C.A. Modi, Assistant Professor, Veterinary Pharmacology and Toxicology, to present the report.
Very good afternoon to all. I am going to present the report of second day of training program on advanced diagnosis technique in livestock and pet. For this technical session, Dr. S.W. Savarkar, Associate Professor, acted as the chairman. Dr. Diri Javia, Associate Professor, Junagadh, acted as a co-chairman. Myself acted as a reporter. On the second day, total 3 presentations were conducted, 2 lectures were organized in the morning session, and 1 demonstration conducted in afternoon session. First, eminent speaker, Dr. B.D. Ahir, Director of Extension Education, MAPSU, Nagpur, Maharashtra, expressed his view on the topic recent advance in diagnosis imaging technique in veterinary practice. He explained the importance of the digital revolution in veterinary practice. He described the imaging technique for the diagnosis disease condition and explained the principle of the instrument and how to work it. He also presented about the various imaging modality which can be used in Indian condition and narrated scope of the branch like telemedicine, telesonography and teleradiography in present scenario. Dr. VD Iyer highlighted the advantage of advanced diagnosis imaging technique for the identification of pathological condition and disease diagnosis. At last, Dr. VD Iyer concluded his lecture by expressing the use of the radiology need to be strengthened by its optimum use in clinical case. He also added some technique in ruminant still needs more development and research. His lecture was appreciated by chairman and co-chairman Dr. B. Javia, Associate Professor, co-chairman. Thank you to Dr. Ahid for accepting the invitation and delivering the lecture. After that, Dr. Hari Prasad P. Aithal, Principal Scientist Training and Education Center, IVRN, Agriculture Campus, Shivajinagar, Pune, Maharashtra, shared his knowledge on fracture management in livestock and pets with special reference to epoxy pin external skeletal fixation technique. He presented in detail about the different type of fracture. Dr. Aithal highlighted the important factor to be considered by the veterinary before the fracture fixation, challenges faced in the veterinary management in animal and important principle of fracture treatment. Dr. Hari Prasad Aithal also highlighted certain key points regarding the post-operative care and management. Dr. Aithal concluded his lecture by highlighting the advantage of the epoxy pin fixation and ESF technique, which help to treat many fracture cases in the livestock and pet. He narrated his unique experience during the presentation also. At last, Dr. Aithal also informed about the activity of training and education center and facility for the information of student. The lecture also appreciated by the chairman and co-chairman. In the afternoon session, the demonstration session on therapeutic and surgical management of prefusal products in gear bulls was presented by Dr. V.D. J.V. Vadalia, Assistant Professor of Department of Veterinary Surgery and Radiology. J.U. Junagadh, he described the surgical technique and therapeutic management which are used at multiple level in the field, farm and herd level by the veterinarian, and he also said the video clip of the practical demonstration of the surgical technique in prefusal products in the gear bulls. Finally, Dr. J.V. Vadalia highlighted post-operative management and complication which may help in deciding the therapeutic protocols to combat the reproductive disorder. The lecture and demonstration were very interactive and more informative for students and training. Overall, the information and knowledge shared by the respective speaker in the presentation of the technical session will definitely benefit to students and faculty. The session was concluded. Vote of thanks given by myself, Assistant Professor. Thank you all.
Thank you, Dr. Modi, for presentation of report. Now, for the day 3 technical session report, I request Dr. A.D. Verma, Assistant Professor, Department of Animal Genetics and Breeding, to continue with the report presentation.
A very good afternoon to respected dignitaries and one and all present over here. I am going to present the report for the day 3rd of this 5 days vocational training. The 3rd day technical session was chaired by Dr. Vishnudev Kumar, Associate Professor and Head of Department of Veterinary Anatomy of this college, co-chaired by Dr. A.A. Wagh, Associate Professor and Head Department of Veterinary Medicine of this college, and myself acted as a reporter. 6th January 2021, that is 3rd day for the training. The technical session started with the lecture of Dr. P. Parikh, Professor and Head, Department of Veterinary Surgery and Radiology, College of Veterinary Science, Anand, with the topic of veterinary endoscopy and overview. The lecture included introduction and developmental history of endoscopy, types of endoscope, parts of endoscope and videoscope. The lecture also included various scoping, discussion in detail along with photographs, schematic diagrams, and various videos of
clinical cases in animals. The brief discussion about the cleaning of endoscopy instrument, advantages and disadvantages of videoscopy, advances in endoscopy in veterinary science was also discussed, and there was a good interaction with participants as well. Second guest lecture was delivered by Dr. S.K. Jirwal, Assistant Professor, Department of Veterinary Surgery and Radiology, Rajivas, Bikaner. The topic was advances in diagnosis of ophthalmic affections in dogs. The lecture included introduction of all the basic neuro-ophthalmic examination techniques, various basic imaging techniques, and some of the advanced imaging systems in veterinary science for dogs. The presentation also included videos and photographs of different techniques applied in veterinary diagnostics. Questions from participants were also discussed with the expert Dr. Jirwal. In afternoon session, the virtual practical demonstration was also made by Dr. S.K. Jirwal, Assistant Professor from Rajivas, on the topic of surgical management of cataract in dogs. A detail about anatomy of lens, type of cataract, diagnosis of cataract, ophthalmic examination of cataract, various surgical management techniques for cataract in dogs, that is ECCE, ICCE, and phacoemulsification, various instruments used in cataract surgery, perioperative and post-operative complications was also discussed in detail along with photographs, videos, and live demonstration. Participants' queries were also discussed along with utmost practical approach regarding cataract surgery in dogs. I thank the Center Organizing Committee for the opportunity.
Thank you, Dr. Ankita, for presentation of report. Now for the report of presentation for day 4, I request Dr. R.J. Padodra, sir, Assistant Professor, Physiology and Biochemistry, to continue with presentation of report.
Good afternoon, everyone. Respected dignitaries over in this for this training. Day 4 was chaired by Dr. H.S. Sosani, Head of Department of Nutrition, co-chaired by Dr. V.K. Singh, EDPC and Assistant Professor of Physiology Department, and I acted as a reporter for the day. The 4-day technical session was started with the eminent speaker, Dr. J. Mahindra, Professor, Veterinary College, Gaduwasu, Ludhiana. He took lecture on the title Advancing Ultrasonography and its application in livestock and pets. He mentioned the different available modes of ultrasonography, and in his presentations, very well we consider the B mode is a very important, commonly used for the veterinary and animal sciences in the institute as well as in the field condition also. He described the different SOPs for use this technique in pets and livestock. He showed many images of the ultrasonography of different normal and abnormal condition of the different organs and systems. Dr. Mahindra, he discussed the M mode of the USG for to understand the movement of the organ in the body. We consider the Doppler ultrasonography techniques is an advanced one for the diagnosis the condition like intussusception in the intestine, renal blood flow, thrombosis, ectopic ureter, etc. conditions. He also explained the shear wave elastography used for the measure stiffness of the particular organ, and many questionnaires arise by the students. He answered well and satisfied the students. The second lecture was delivered by Dr. T.D. Patel, Professor and Head Veterinary College, Sardar Kushinagar, Dantewada University, on the advanced diagnosis techniques for the diaphragmatic hernia and buffaloes. He emphasized and described the different conditions and the reasons why buffalo is more prone to the causes of the EH. And also he manifested, he saw given the different clinical manifestation with the techniques for the diagnosis of the diaphragmatic hernia. He also, so many questions are to be raised by the students and replies to the students. In the afternoon session, the demonstration lecture on application of advanced diagnostic images technique in the veterinary practice, delivered by Dr. Deepak Kumar Tiwari, Assistant Professor, Luas, Hisar. He told the different constraints, the technical and financial for the image diagnostic techniques in the animal sciences, and also he described the different diagnostic imaging techniques in the veterinary science. Particularly, he demonstrated very good videos on the radiography, different techniques and types of the digital radiography, computed radiography, direct and indirect digital radiography. Also, emphasis on the different techniques like Doppler USG, elastography, endoscopy, CT, MRI, DEXA scan, and the thermal new coming imaging, thermal imaging, and nuclear images by the infrared thermography is described very well. He showed the many videos for the different techniques. All the lectures and demonstration of these days were very informative, interactive, and it's contained all basics for the particularly UG students, and it may helpful to the undergraduates in the future. Thank you very much.
Thank you, Dr. Padatra, sir. Now for report presentation for day 5, I request Dr. Amrita Vasav, Assistant Professor Veterinary Physiology and Biochemistry, to continue the presentation of report.
Very good afternoon to all. The fifth technical session, chaired by Dr. M.D. Odedra, Professor and LPN Department, and co-chaired by the Dr. D.B. Barrett, Veterinary Microbiology, and reporter myself. The fifth technical session on 8 January 2021 included 3 lectures by eminent speakers from the various universities and private organizations. The first technical presentation was delivered by Dr. N.H. Kelawala, Honorable Vice Chancellor, Kamdev University, Gandhinagar. Dr. Kelawala had delivered the technical presentation on role of alternative and complementary medicine in veterinary surgery with special reference to acupuncture. He discussed at length the difference between Eastern and Western concept of the acupuncture and their importance in veterinary surgery. He also highlighted the common acupuncture points with the affected area of the body. From the various acupoints, he discussed in detail about the acupoint red zone, that is GV26, which has been traditionally used and got significant results in cases of the apnea and cardiac arrest. At last, he concluded his topic with the remark that acupuncture can play a large role in pain management and can be integrated into veterinary practices. Dr. R.N. Chaudhary, Associate Professor, Luwas, Hisar, Haryana, presented on diagnostic radiography in large animals. He briefly discussed the difference between radiography and ultrasonography and their significance in the diagnosis of veterinary surgery. He also exchanged his view on how radiography is the key diagnostic tool for many diseases and has an important role in monitoring treatment and predicting outcome with the wide choice of tools and techniques available for the detection. The third technical presentation on importance of advanced diagnostic techniques in pet industry was presented by Dr. Chirag Javia, Director Pets and Paws Veterinary Hospital Private Limited, Ahmedabad, Gujarat. He discussed various imaging techniques like digital radiography, computed tomography, and magnetic resonance imaging that are currently available for clinical diagnosis and having great demand from the veterinary clients. He concluded his talk with the remark that diagnostic imaging techniques are highly sensitive and non-invasive method that provides the accurate anatomical images that are used to investigate the functioning of the specific organs. At the end of each technical presentation, queries from the participant and faculties were also discussed with the experts. Overall, all the presentations during the technical session were valuable to the students and faculty members in the understanding of advanced diagnostic techniques in veterinary surgery. Thank you.
Thank you, Dr. Amrita, for presentation of report. Now, at the end of this 5-day vocational training, the participant students, they also would like to share their experience and feedback about this training. So in that context, I would like to first invite a student from 4th professional year of BSc and AH, Ms. Kajal Gari, to provide this feedback as a representative of students. Okay, Kajal, are you there online?
Yes, sir. Yes, sir.
So you can continue.
Yes. Good afternoon to all. Myself, Kajal Gavi, studying in 4th year BVSC and AH at College of Veterinary Science and Animal Husbandry, Junagadh. I want to convey my thanks to Honorable Vice Chancellor Dr. V.P. Chovatia, sir, our Principal and Dean Dr. P.H. Tank, sir, and Dr. Sivaji, sir, Organizing Secretary and his committee for organizing this exceptional vocational training under IDP. In this 5 days online vocational training, we learn about different diagnostic techniques like computed tomography, endoscopy, ultrasonography, radiology in very easy and understanding way. We got to know in detail about fracture management with external skeletal fixation in pets and livestock, and also about management of preputational prolapse. We learn many new things in ophthalmic affection and cataract. in dogs and also about diaphragmatic hernia diagnosis. Thank you to all eminent speakers for sharing their proficient knowledge to us in palatable way and boosting our professional knowledge that will be going to help in future for sure to treat livestock and pets. Thank you.
Thank you, Kajal, for sharing your feedback and experience of this training. Now, as a representative of student, one more student I invite from third professional year of BSc and AH, Mr. Gajendra Singh, to continue with the feedback. Gajendra, are you there?
Yes, sir.
Okay, so you can continue.
Good afternoon to respected VC sir, Dean sir, my professors and seniors. My name is Gajendra Singh and I am third year BBSc and AS student. I have attended almost all lectures and have gained lots of knowledge regarding surgery and its different diagnostic techniques, which is the first requirement for any surgical procedure. During this whole training program, I got to know about different VR, AR, and AI technologies, which are very useful to create and enhance our psychomotor skills. I also got to know about different advanced diagnostic and imaging techniques and their standard operative procedure to get accurate results. I am very thankful to our respected Dean Sir and Department of Veterinary Surgery and Radiology for organizing such a great vocational training program and gave us chance to enhance our practical knowledge during this session. Thank you so much, sir.
So thank you, Gajendra. Now I would like to request the key person and the guiding force behind the conduction of this type of IDP trainings in College of Veterinary Science and Animal Husbandry, Junagadh. I request respected Principal and Dean, Dr. P.H. Tank sir, to provide remarks about this training.
Namaskar. Today's plenary session, we have with us a learned plant breeder and our Honorable Vice Chancellor, Dr. V.P. Chogotia sir, who is Director of Research and Dean PG Studies, Junagadh Agricultural University, Junagadh, and above all, under the aegis of IDP, which we are conducting activities, he is the principal investigator. The project as a whole has been sanctioned by ICR and being funded by the World Bank. And very rightly, the Faculty of Veterinary Science is harvesting the fruits of all the financial and technical support of this project under the aegis of ICR with the guidance of the authorities of Junagadh Agricultural University. I am happy that all the faculty members along and across the discipline have joined this vocational program, which is not limited to the students of only veterinary college or faculties of the Junagadh only, but has crossed the boundaries of the Saurashtra, our state, India and across. I am happy that many of the participants from Bangkok, Bangladesh, Singapore and all were also consistently a part of this training, vocational training, and have interacted with our faculty students and strengthened the exact motive of institutional development. The experts in various fields of veterinary surgery and radiology along and across the country and the private practitioners, the upcoming neovets, internists, and the students from other SIUs, Anand, Navsari, SK Nagar, all joined, and I came to know that more than 1,500 registration forms were enrolled. And at every session, as per the likings, they joined through the link, and the rest were enjoying the selected virtual demonstrations as well as the deliberations on YouTube, which is uploaded lively also, and now also as a reprographic, it is available in the YouTube storage. So this will be a permanent asset, and Junagadh Agricultural University and Faculty of Veterinary Science will be daily browsed depending upon the requirements and the thirst of the area which they want to undergo to update their knowledge. I am also happy that though it is the 11th year being completed, the faculty has come out of cradle and started running in almost front-running institutes. And when it comes to surgery, our surgery department and the facilities, diagnostic facilities, paraclinical subjects and all are no more lesser than any state veterinary colleges along and across the India. The department in particular, it being my mother discipline, I am proud to spell out that we are almost matching and complementing all the facilities. Some are better than even the advanced and older centers, and we are doing almost equivalent, comparable clinical activities and the research at par with the older centers like Chennai, Ludhiana, Hisar, Rajasthan, and Mahsus. We came to know that various experts, those who were here in past days for external examination and all, they physically also appreciated, and with this virtual IDP has given us the worldwide famous that there is college which is advancing in leaps and bounds, located at Junagadh, and the faculty is contributing. Thanks to the IDP objectives and the financial support that we are enjoying today. So this is together more than 16th vocational training so far we have conducted. During this financial year, it is the 4th vocational training. And in days to come, we will be having vocational training on nutrition, animal genetics and breeding, and one workshop hands-on training in pharmacology, and one vocational training in physiology and biochemistry. So this is one of the opportunity that in spite COVID-19 epidemics, though physical classrooms are not conducted, during this 5 days training, I am seeing that almost all the constituent syllabus of the veterinary surgery and radiology are being covered by the national experts and being demonstrated virtually online under the prevailing circumstances. So students, the faculties, and above all, I too was benefited because in between I too attended few of the lectures, presentation and demonstration. And I also got an opportunity to refresh the knowledge which I was not in a consistent touch being in the administrative work. But I am happy that Junagadh has now its own place in the national level. So also some of the international reputed scientists also appreciated the modalities we are adopting in various horizons to combat the illness and the diagnosis in the animals, livestock and pet. I am happy again to give my remarks that it is the Junagadh which is now preferred by postgraduate students. It is the Junagadh which is preferred for diploma, undergraduate, and I at the outset congratulate many of my faculty members who with a great responsibility have completed their postgraduates, acquired promotions, and very recently, Honorable Vice Chancellor facilitated us to give sanction, to accord sanction for 19 PhD in service candidates, which are very recently occurred. And in spite of a lot of hurdles, we could come out this big obstacle and all have probably been served the in-service orders. So it is you, it is our students, authority, and the Almighty God together have graced the Veterinary College Junagadh so that I am able to speak in a bit high sound and a bit broad chest. Thank you.
Thank you very much, sir, for providing your valuable remarks and for highlighting some of the important areas of this 5 days vocational training. Now it's our proud privilege to have Honorable Vice Chancellor JU, Dr. V.P. Chotia, sir, with us at this juncture to encourage us and to guide us at this moment. So I request the President of this plenary session, Dr. V.P. Chotia, sir, for the presidential address.
Good afternoon to all. In the occasion of plenary session, we have with us Dean Faculty of Veterinary Science, Dr. Taksal, Organizing Secretary, Dr. Kalekar, Organizing Secretary, Dr. Sharma, all the faculties of the veterinary discipline. Veterinary science, especially in animal health sector, is progressing in leaps and bound and has attracted the minds of the student, faculties, academic administrators, research organizers, and the society at large. Veterinary surgery and radiology has its own place in veterinary and medical health. Advances in it is also to the veterinary graduate at highest preference for PG prefers veterinary surgery and radiology department at priority based consistently over the period. Faculty of the veterinary science under Junagadh Agriculture University has well established animal health service with supportive diagnostic facilities and has created research resources material for the education, research as well as in extension activity. The expertise services at veterinary clinical complex has been well accepted and well appreciated by the pet owners. The faculty has well utilized the opportunities under the aegis of National Agriculture Higher Education Program under Institutional Development Plan funded by the World Bank at ICR, New Delhi. I am happy to congratulate the organizers for the satisfactory conducting the virtual vocational training on advanced diagnostic techniques in the livestock and pets. And I wish to develop furthermore to fulfill the requirement in front of the academy and the society. Thank you.
Thank you very much, Honorable Vice Chancellor sir, for being with us at this moment and for providing appreciation and encouragement to our faculty. So thanks again for the presidential address. And at the end of this plenary session of this vocational training, I request Joint Organizing Secretary and Assistant Professor PVCC, Dr. J.V. Vadalia, to propose vote of thanks.
On the plenary sessions of the 5 days vocational training, advanced diagnostic techniques in the livestock and pets, I am very much thankful to Dr. V.P. Chovatia sir, Honorable Vice Chancellor of the JAE Junagadh and Presidents of the today's plenary sessions and the PI of the IDP scheme. So, in spite of his busy schedule, sir remains present at here. They appreciate the work of the committee member. They appreciate the organizers and also appreciate all the faculty members for continuous development of the faculty, staff, and the development of the college. I am very much thankful to you, sir. I am also thankful to Dr. P.H. Khan, sir, Principal and Dean, College of Veterinary Science and Animal Husbandry, JAE Junagadh, and the co-PI of the IDP scheme. Sir, without your continuous guidance and the support, the successful completions of this training is not possible. So thank you very much, sir, for your continuous support, for your valuable guidance and your remarks and the appreciations of the staff efforts and the committee members. I am very much thankful to you, sir. I am thankful to Dr. Talegar, who is the organizing secretary of this 5 days training and taking the pain and the hard work to make this 5 days training successfully. I am thankful to co-organizers of this 5-day training, Dr. R.H. Bhatt sir and Dr. Arun Sharma sir, to continuous supports and the giving guidance to all the members, central committee members, and the taking the pain and the hard work to make it success. I am also thankful to all the central organizing committees for this nice arrangements during this 5 days trainings. And I am also thankful to the different committee members, committee conveners, co-conveners, and the different committee members of the different committees who are taking the hard work during this 5-day training to make it more successful, easier. Thank you, sir. I am also thankful to the chairmen, co-chairmen, and the reporters of all the 5 days technical sessions. I am thankful to all the speakers from this college, from the state and out of the state to giving their valuable knowledge during this 5-day training. I am also thankful to all the university officers to providing the platform and the facilities to conduct smoothly this training. I am also thankful to all the faculty members of this college. I am thankful to the participants from the country, from the state, from the country, and all the participants from outside of the country. I am also thankful to all the students who have participated in this 5-day vocational training. I am thankful to press and the media persons who cover nicely during this 5-day training. I am also thankful to one and all who are directly and indirectly support and make efforts to make this 5-day vocational training successful. Thanks to all. Thank you.
All the best.
Thank you.